it's important that as you start thinking about retirement, that you know that you need to begin to do your homework early enough, because there are many things to consider. The whole process from the beginning stages of your research to actually retiring can be confusing, overwhelming, and to certain individuals, they even say, do I even want to do this? Because it's so much to take on. It's a big, thorough process. What you have to know is that there's a lot of ground to cover, and it is not a one-stop shop process. There are different people that you will talk to along the way as you plan for this, with various expertise that you will need to contact on your path to retirement. One of the first things that you should be looking at when you consider retirement is Social Security. So if you are turning 65 in 2022, that means you were born in 1957, and you may be thinking, this is it, this is my time to go, 65. But are you aware that your normal retirement age for someone that was born in 1957 and turning 65 in 2022 is actually age 66 and 6 months? So it is important that you are aware of when your normal retirement age is, early retirement age, and the top of the level, which is age 70, according to Social Security. If you haven't done so, you should be going to ssa.gov. The website is specific to everything related to Social Security. You should be creating a login in your My Social Security account. It's a secure login where you, of course, are entering your Social Security. But every time you log in, you need a special code that they send you. They send you reminders every year to check your history with Social Security. And it is important to go here early enough, even if you're not close to retirement, to review your earnings record, to make sure everything is coming through in your work history, in your Social Security record, because all of this impacts what you're going to get paid when you file for retirement with Social Security. So unless you were born after 1960, at which point those of us born after 1960, we know that our normal retirement age is age 67. And why is it important to consider normal retirement age? Is because overall, the standard when we retire is to replace at least 70% of our income from all sources when we retire. And Social Security, if you are starting Social Security at normal retirement age, so you don't get a reduced benefit, you're likely going to get at the most 40% of that income replacement from Social Security. So it's important that you know where you stand and when you could file for full retirement benefits to start from Social Security. The other thing that I get a lot of inquiries about is, when do I start Medicare? When do I start Medicare Part A, Part B, Part D? Do I even do any of these things? So it's important that you know that Medicare Part A, which is hospital insurance, you should be doing this when you are turning 65, regardless of employment. So if you're 65 and you continue to work, you should be applying for Medicare Part A to begin. And everything else continues as normal with your benefits with Cuny. Medicare Part B, you're only going to do that when you are officially retiring. And therefore, you're going to start paying a premium, which is likely to be at this point $158.50 monthly for 2022. It's not confirmed, but it's likely to be that amount. And again, that is medical insurance, and it covers the bulk of your health coverage because it's medical insurance, but you're only going to do this when you're officially retiring. And you're going to get guidance from human resources as to what the official retirement date is and when to do this. And one important note when it comes to Medicare Part B is that they only started on the 1st of every month. So if you are retiring within the middle of a month, you're applying for the beginning of that month of retirement. If you retire at the end of a month, you apply for Medicare Part B to begin the 1st of the following month. So again, you will get a lot of guidance on how to do this. In the link that you obtain with folders of documents, there are specific guides that I put together based on your retirement system that you have and based on your age. And so every step of the way, you get guidance on what to do as you're going to meet with HR, the packet of forms that you get, and the whole process with Medicare, and even after you are officially retired, what things you need to do. One thing to note is that a lot of people get confused about hearing about Medicare Part B and then this income-related monthly adjusted amount, Irma. So it's all Medicare Part B, what you're paying. But if your modified adjusted gross income is above a certain threshold, you're going to pay more than the standard. And again, the standard is expected to be $158.50 for 2022. You get an overall bill or letter from Social Security saying your Medicare Part B premium is, let's say, $200. It's an overall figure that you're seeing, but you know what the standard is, and the difference between what you're paying and the standard, that is Irma. So it's important that you just understand that you're paying a little bit more because of your income or how you file, but that's all Medicare Part B together. You're not at any point going to enroll in a Medicare Part D plan out there if you are retiring with benefits from Cuny. Okay, so you're never going to do that because you get this from the welfare fund, and my colleague Patrick Smith is going to be talking about that later on. So how do you know if you're eligible for retiree benefits? And this is the $1 million question. Get a lot of calls, a lot of emails, because everybody wants to know, when can I retire from Cuny but retain my benefits as a retiree? So the criteria differs depending on your retirement system. If you are a TIAA member, you need to be age 62 or older, have 15 years of full-time continuous service with Cuny. However, if you were appointed prior to August 31st, 1985, then the age and time frame is less. You should refer to the contract or contact me. If you're in a full-time PSC title with Cuny, you need to maintain yourself in a full-time title throughout and retire from that full-time position. You will start a small lifetime income annuity from your TIA optional retirement plan. TRS members and NYSERS members, the criteria is equal, the same. You have to be age 55 or older, have 10 years of credited service with TRS or NYSERS, be in a full-time PSC title with Cuny, and retire from that full-time position, starting to receive the pension from the qualified pension plan. Depending on your tier, if you retire prior to 62 or 63, depending on tier 4 or tier 6, and you have less than 30 years of credited service, then your pension will be reduced for life based on the age at retirement. And again, you will talk to me or you will talk to NYSERS to discuss the details of that. So who are you contacting prior to your meetings, prior to retirement, who are you going to reach out to? And it's important to know that it all depends on what retirement system you have. If you're a TIA member, you are to meet with your advisor or a TIA consultant assigned to your college. In the packet of, in the link that you got with the forms and documents, those of you with TIA did receive the name, phone, and email of the consultant from TIAA that is assigned to your college. You could reach out to them directly that way, instead of just calling the regular 800 number with TIAA to set up a meeting. Otherwise, if you have an assigned advisor, financial advisor with TIAA, you will contact that person directly. You want to discuss if you're on track to meet your income goals or retirement. Obviously, because TIAA has all your information about investments. They do illustrations and different income options. You want to have a couple of meetings as you plan for your targeted retirement date. You also want to discuss with your TIA representative the Cuny requirement for New York City Health, which is setting up a lifetime annuity from the optional retirement account with TIAA. And what's important to know is that also in the link with packet of documents, you have a specific document that discusses this lifetime annuity requirement. TRS members, and this also applies to NYSERS members and PSC titles. You want to look at your annual benefit statements and look for the QPP estimate of options page. Usually it starts from page 3 on. And if you have a TDA with either of the retirement companies, you want to look at the estimate options page of the TDA as well. And how you get the ABS, the annual benefit statement, since 2018, they're not mailing anything to your homes anymore. A lot of people are clueless or think that they're not receiving this anymore. But indeed, you have to log into your account online and go to statement documents and look for your annual benefit statements there. TRS just sent in the 2021 annual benefit statement this past October. If you do not see estimates on the annual benefit statement, that means that your service is not up to date, and you need to be proactive in contacting the college or colleges where you worked and ask that they send service records to TRS to update your total service. So you need to do this and make sure that before you talk to me, if you are with TRS and you're wanting to discuss, retirement and estimate of options, that your service is up to date, because I don't help you with that. You have to do that with TRS directly. It's also important if you want to know more about your tier and how the formula works and all of the behind the scenes, you could attend a TRS retirement class. The website is here. You're going to have access to our slides, to our presentations after this whole conference. And you could always just go into the TRS website and go to education and see the classes that are listed. They're based on your tier. So you would obviously enroll in a class based on the tier that you're in. And that's a great first step before having a conversation with me as you get closer to retirement. So again, only contact me for a counseling session once you know that your total service has been updated. The process once you decide to retire. So it's important that a lot of you know that retirement is not when you go on leaves. Retirement is the official date that you're given by HR. Or for most of you, if you have Travia leave, it's after Travia leave is done. It's important to know that your HR office will basically control the process tell you the official retirement date, tell you what kind of leaves you have. If you are a faculty, if you have a full Travia or a reduced Travia, or if you've taken Travia before, then you have no Travia, it's straight retirement. Your HEO or any other title, what you have specifically in terms of leaves before you go on Travia leave and before you officially retire. The semester before you go on leaves, you want to meet with HR. Obviously, you will your first step is to provide the Travia leave form to HR, and then HR will guide you thereafter as to when they're providing the retiree benefit forms. They'll discuss that with you, and you will return all those forms back to HR. You will go to Social Security office 3 months before your official retirement date to apply for Medicare Part B, only if applicable. Obviously, if you are 65 or older by the time you are retiring, TIA members, you want to have your last meeting with your TIA advisor at least 3 months prior to the official retirement date. And also TRS members, you want to meet with me when you are 3 months away from that official retirement date, because that's when the window opens up with TRS to do any of the documents with them. NICERS members, you will meet a counselor at NICERS also 3 months before the official retirement date. After the whole retirement process, you do want to make sure that you understand Medicare Part B, Irma reimbursement process, what to do, what forms did HR do, what forms do you have to do. Like Irma reimbursement form is something that the member usually has to handle. And this usually happens the year after retirement when you get the reimbursements. So you want to make sure that this is all set up when you are retiring. So the links that you receive with documents, again, based on the retirement system that you have and your age, has a wealth of information, a lot of resources within that. You were also provided with useful websites like Medicare.gov that you could visit, and you should visit to get familiar with some of the costs and some of the processes of what you have to do. You have a specific guide that I told you that I put together, and that guide is really telling you what to do along the way, before retirement, as you're retiring, and even after you're retiring. Again, referencing the Medicare Part B reimbursement process. And you have the retirement specific documents. So with that, I am going to leave you with Talene Spengen from Cuny University Benefits Office. She is going to do a deep dive. Some of these things will be referenced, but more in depth and in more detail. And I will be communicating with you via chat, via the Q&A, answering some of your questions.
Here are some outstanding questions. Can you apply for Medicare Part B online?
Yes.
Yes. When I retire and go on Travia, I'm in TIAA. When am I eligible to work part-time at the college getting paid on Cuny payroll? Do I have to wait until Travia is over?
There is a document that was provided about Travia, and it's all about the contract. You're allowed to work, I believe it's one course during Travia, and you could continue to work as an adjunct. You would need to speak to a PSC counselor at the union to make sure that it's all within, what you're allowed to do.
This question says, will I have 45 days. Kind of complicated here. This is about Travia and prior use of, please review the, will HR schedule all the days?
Any further questions about Travia and all of that? We probably want to hear what Helene will discuss.
Yeah,
because
so
she's
if you
do
can
a deep dive. Yeah.
Hold that thought. We're going to go into Travia. Okay, when is the best time to contact HR for the official retirement date?
Helene is also going to discuss that.
Okay. If you have $36,000 in Social Security and $50,000 in pension, so I guess this is income, will you pay Irma? That would be $86,000 in, it's modified adjusted gross income. So it's hard to answer that question.
It depends on how you file and all of that. Yes.
Yeah. That $85,000, it's sort of approximate. I'm not quite sure what it will be in 2022, but it's modified adjusted gross income. So those figures may not add up to putting you over the threshold.
Right.
Someone says, send me the online file since I didn't register for this meeting. I think that link is in the chat for, if you mean
the Q&A.
Yeah. No, I mean, and Naomi put the link. If you didn't see the agenda, you want to see the agenda, Naomi has put a link there, and I think that includes everything.
It doesn't include the materials that were
okay.
You could email. You could contact
on Wednesday.
me.
So I'll put the link in for those.
Okay. Yeah, because it depends on the retirement system and the age of the person. So.
Yeah.
Right. Okay. If I want to retire before 15 years of full-time service, is there any way to access welfare fund benefits? For example, could I pay until I get to 15 years? No, sorry. When the spouse reaches 65 and applies for Medicare Part B, is there a reduction in the amount of the medical insurance the employee pays for coverage? We understand this. If the spouse reaches 65, no, there is not. Because if the employee, no matter what age, right, 65 or over, you're still working, you're covered by Cuny insurance, and your spouse is a dependent on that insurance, the spouse is not going to go on Medicare Part B either. As long as you are the member and you've put your spouse as a dependent on your insurance, no one goes on Medicare until you retire.
And Talene also has a grid that she's going to be showing about that. Yeah.
What if I plan on retiring in less than 3 months, say an emergency situation?
Depends on your retirement system. You contact TIAA, you contact me, you contact HR.
When you are on Travia leave, do we still have health insurance from the PSC? Yes, and your basic health insurance from Cuny and the city of New York as well. When should we get Medicare Part B? If you are 65, 3 months before your date of retirement, 3 months before the end of Travia, you want to sign up for Medicare Part B. So you get your little card, you can copy it, and that becomes part of your retiree health benefits applications. Can you apply for Medicare while still an active employee? Sure, you can. If you turn 65, you can sign up for Part A. It's not mandatory, but it's a good idea. It gets you into the system. You don't want to sign up for Medicare Part B because you could do it, but you'd be paying for it and you would never use it. As long as you are an employee, Your basic health insurance from Cuny and the city of New York remains primary. So you could sign up for Medicare Part B when you turn 65. You'll never access those benefits, and you'll be paying a monthly premium that is not reimbursable until you retire.
I think, it's we're going into Talin's time. So I think a lot of questions will be answered after she does her deep dive, because she has a lot of material to cover.
Good. Yeah, I think that's true. Things, everything I've got the rest of this is all about Medicare stuff. So we're going to address those things in the
chat.
Talin's bang. So, right. Can I do service unpaid during Travia, like chairing dissertations or some administration work?
He's gonna cover
I guess
that.
that's up to your department. It's hard. I mean, unpaid work, I think that's a question you should address to your department chair. This is another insurance coverage. My HR office has not updated my service record since 2018. Why is that, and what can be done with that? Any ideas?
What was the question? The HR office what?
My HR office has not updated my service record since 2018. What can I do?
They just send an email with the TRS member number and say, I need a service record update from January 2018 until present. Please send it to TRS. Please send me a copy for my records. Talene, are you able to jump in to start?
I'm ready.
Okay, we're going to go to Talene, and anything that's left over we'll get to.
Good morning, everyone. It's so nice to be with you, even though it's remote. I'm going to share my screen so that I can begin my presentation. I hope everyone's able to see the pre-retirement seminar fall 2021 instructional staff. Yes? Okay. These are some of the agenda items the topics that I'm going to discuss. I'm going to give you an overview of these things. And I ask that when you do ask your questions, you keep them general, questions that could pertain to your colleagues and peers. Please hold off on your personal circumstances when you ask these questions, because we don't want to get into that level of detail. This is intended to give you a broad overview of all the benefits that you are eligible for as a Cuny retiree, and feel free to reach out to me if you have any specific questions about your own personal circumstances that you think are different from the broader community. So these are some of the things we're going to talk about. I think I did miss a slide. I'm Talene Spengian. I'm the Director of Benefits in the University Benefits Office. This is my email address, and you feel free to email me at any time. But I do want to say before I start, I get a lot of emails and calls from people who are considering retirement, and your campus benefits officer should be your first point of contact for all these questions. If there are very nuanced questions that you have, they will escalate it to me. But I shouldn't be your first point of contact. I support the campuses, and you should really go to your campus benefits coordinator or specialist when you have questions about your own retirement. So this is language that is taken from your contract. your hire date drives your eligibility for retirement. It determines your tier and what the rules are surrounding retirement with regard to your age and years of service. I'm not going to go into this much detail. I'm not going to differentiate between the tiers because for the most part, this is probably the tier that pertains to most of the people on this call. If you are appointed on or after September 1, 1985, and you have separated from Cuny at age 62 with 15 years of pensionable service, continuous full-time Cuny service, you would be eligible for retiree benefits. Of course, this 15 years pensionable service pertains to TIAA participants. If you were separated from Cuny before age 62, but you had 15 years of pensionable continuous full-time service, you can leave Cuny, and then when you do reach age 62, you can come back and request your retiree benefits. But that hinges on what you do in the intervening years. If you go to work for full-time employment in another college or university in the intervening years, it may disqualify you from requesting your retirement benefits. So that is a contingent to this rule. If you are a TRS or NICERS, you need 10 years of credited service. And if you were working 20 hours or more a week, you could be eligible for city health benefits. And if you receive a pension from TRS or NICERS, you would be eligible for retiree health benefits. This is a retirement timeline. It's a rough timeline of the steps that you should take at different points in time. Verification of service is important because it drives everything about retirement. It determines if you're eligible for Cuny retiree benefits or not. You should start that process 6 to 12 months before retirement, or 4 years if you're considering phased retirement. Travia, you should request Travia 4 months prior to the start date. You should contact your pension systems 5 months prior or 3 months prior, depending on whether there's a discrepancy in your years of service or your salary is not updated. Those are all things that should be ironed out before your retirement. So, if you're considering retirement, you're within 5 months, that's something that you should consider reaching out to your pension system and making sure that their records are consistent with your understanding of your service history. Medicare Part A, you should apply for 3 months prior to your 65th birthday, whether or not you're working. Medicare Part B, you should apply within 3 months when you're 60, if you're retired and you're 65. I will go into this in a little more detail. This is just a brief touching on this topic. Meet with your HR office at least 2 months prior to inform them of your intent to retire. Some of these things are not hard and fast. It is a courtesy to your department to notify them as soon as you know of your intent to retire. And then the HR office should also know so that they can start planning and assisting you with all the documents. And, they all have packages of documents ready to go as soon as you say you're ready to retire, so that you can understand all the steps that you need to take and complete all the paperwork. And then they will distribute those documents to the various agencies that they need to go to. And also, if you are participating in any of the NICET benefits, you should contact NICET to understand what your options are with regard to maintaining those plans and policies into retirement when you're no longer getting a paycheck and the premiums are not deducted from your pay. You should discuss what your options are with regard to your NICET benefits. So how do you pay? Retiree health is probably the biggest part of your retirement benefit from Cuny. And the question is, how is it paid? If you're a TRS member, then the premiums for retiree health are deducted from your pension check. If you're a TIAA participant, and I know Sandra already went over some of this, TIA participants have to reserve $50,000 in their accounts to pay for retiree premium health benefits, the premiums for your health benefit. Even though you're required to reserve the $50,000, you don't have to annuitize all of it. The minimum that you have to annuitize is $10,000 to cover the monthly premium. For some of you who are on the GHI plan, the monthly premium is a small amount, but regardless, you still have to annuitize $10,000 at a minimum. And the reason is so that the setup kind of replicates receiving a pension. So you're getting a lifetime annuity every month. Again, it's ensured that your premiums are paid for from your annuity, and that way you never run the risk of missing payments and losing your health coverage or having a lapse in your health coverage. But some of these things are changing, which I'm going to talk about a little bit in future slides. So verification of service is really important, especially if you work at multiple campuses. We have to make sure that all of your service is accounted for and reported, whether it's to the university benefits office or your pension system. This is a good time to discuss that with your HR office to make sure that your understanding of your service history is consistent with what's in your records in the HR office, because oftentimes you're hired at Cuny as an adjunct, and some of that time is not pensionable, especially if you're in TIAA, and so your original hire date is not relevant in that case. The date that you became a full-time employee is the date that becomes relevant for the purpose of retirement. So your understanding of that hire date of your retirement of your hire date that pertains to retiree benefits could be inconsistent with what the campus understands it to be. So this is a good time to iron out those discrepancies if one exists. And also, as Sandra mentioned, this is a good time to review your Social Security earnings over your lifetime of work, just to make sure that they also have records that are consistent with your understanding of your work history. They do have ways of verifying it if there is a discrepancy. So this is a good time to log in, create a user ID with Social Security Administration, look at your history, and make sure that it is consistent with your recollection of your work life. One of the benefits that you have as a CUNY retiree, if you are in the TIAA, if you are in the ORP, and you have 15 years of service, is phased retirement, which allows you to work a shorter workload as you phase into retirement. You can phase in increments of 1, 2, or 3 years. It has to begin with the fall semester. You have to apply for it almost a year before your intention of going on phased retirement. And the decision to phase is irrevocable. So once you apply for phased retirement and all the approvals are signed off at your, in your department, the Human Resources Office, you cannot revoke your decision to phase into retirement. And once you begin, you have to retire. You cannot come back to work. One of the things, and it also supersedes the right to return to work after Travia. So oftentimes professors, instructional staff take phased retirement for 3 years, and in the final spring semester of the 3rd year, they go on Travia leave, which I'm going to talk about. Even that Travia leave, you cannot come after. When Travia leave is the final semester of your phasing period, you cannot come back to work after that. You have to retire. When you phase, your workload is reduced to 50%. Your salary is reduced to 50%. And as I said, you can phase in increments of 1, 2, or 3 years. For HEOS title series with 13.3B status and tenured CLTs, you also have the option of phasing, but for you, phasing is either a 6-month or 1-year period. Your workload and salary is reduced to 80% as opposed to 50%. And you also can take Travia in the final semester of the final period, the final 5 months of your phasing period, in which case your salary goes back up to 100%, which is also the case with those who take instructional staff who take Travia leave at 50%. That final semester of Travia, phase retirement, the final semester of Travia reverts back to 100% salary. So what is Travia? Travia leave allows you to be paid out half of your unused sick leave. If you have a maximum of 160 days of sick leave, that is rounded up to a full semester or a 5-month period. Travia leave is usually taken in the spring. And when that is the case, you work in the fall semester of that academic year. You take Travia leave in the spring. July and August, you're paid out your annual leave, and your actual retirement date will then be August 27, or thereabouts, whatever that last day of the summer is before the fall semester begins. So if you have less than 160 days, then there's no rounding up that takes place. Your actual, whatever hours you actually have are calculated and projected to see at what point that gets you in the semester. For example, if you only have 100 days of sick leave, you would only get 50 days of Travia paid out from the spring semester and, projected to whatever point in the semester that gets you to. Of course, during that period, you are being paid for holidays. So the holiday is kind of jumped over. You get the holiday, and then the next business day, the sick leave will be applied to the next work day. Travia leave is the earlier that you notify your department that you intend to take Travia, the better. It's a courtesy to your department and your colleagues. Most people take Travia in the spring, but if you happen to take Travia in the fall, which is rare, but it does happen, then your retirement date will be that last day before the spring semester starts. And in that circumstance, you will not get paid the subsequent summer, July and August of annual leave. So your actual retirement date, so you take Travia in the fall, your retirement date is January 28 or 29, whatever that last day is before the spring semester starts. And then the subsequent summer, you're not eligible for annual leave. When you are, if you're not at the maximum of 160 days, you should consider your, when you make a decision to participate in a catastrophic sick leave bank or dedicated sick leave, you should consider how that may impact your ability to reach the 160-day maximum for Travia, because it's in your best interest to have the maximum, because that will get you a full semester of full-time pay or a full 5 months of full-time pay. Faculty who take Travia leave in the spring will be paid out their unused annual leave over the summer, as I mentioned. HEOs who take Travia in the spring will have their unused annual leave paid out in a lump sum before the commencement of Travia. And if I'm going a little too fast, I apologize. I have no way of getting feedback from you while I'm speaking, but I will say that these slides are available on our website, and you can always refer to them if you need to. There is an annual leave cap for non-teaching instructional staff. For ECPs, that cap is 50 days. For HEOs, that cap is 45 days. And what that means is if you have annual leave that exceeds those days, The Office of the State Controller, OSC, who manages the CUNY payroll, will not pay out a lump sum in excess of those days. So you should, if you have exceeded these thresholds in your accrued annual leave, you should spend them down so that when you retire, you're not capped at what can be paid out in a lump sum. If you're faculty and you're on fellowship leave, you have to return to service for a full year before you can go on phased retirement not phased retirement, but Travia leave or retire. So if you're on fellowship leave, you have to come back and serve a full year before you can retire. So this is probably the most complicated part of retirement, is how to coordinate your retiree health with Medicare. When do you apply? When do you apply for A? When do you apply for B? What if your spouse is under 65 and you're over 65? And there's so many moving parts when it comes to figuring out what to do with this. And
hey, Talene, can you make it a little
yes,
bigger?
Yes. I'm going to switch to the actual document. This is just a slide. So let me go ahead and do that now. How's that?
Much better.
Okay, good. So, so what we've done, because this is so confusing and there's so many contingencies and there's so many things that can, affect your decisions about what to do and when to enroll and when not to enroll, we came up with this grid. So as an exercise, what I'm going to do is go through how to read this grid. Because obviously it's too much information to memorize. I don't even know all of it off the top of my head. I mean, I do, but it's hard to, but that's because I talk about it all the time. It's hard to keep track of. So I'm going to go through a couple of these scenarios and explain to you how to read this grid. So the very first column is the subject of our question. So are we talking about an active employee? Are we talking about a spouse who is under age 65 of an active employee? Are we talking about a spouse who's over age 65 or under age 65 of an active employee? So the first column is the person that we're asking the question about. The second column pertains to the age of the CUNY employee. So is the CUNY employee under age 65? In which case we would refer to the second column. Or is the employee over age 65, in which case we refer to the third column. And in the box, it has instructions on what to do. So the first line is for an active employee. So if you're an active employee and we're talking about you, the employee, and you're under age 65, we refer to the second column, which is that your primary health insurance is one of the New York City health plans that you're in. And Medicare is not applicable because you're under age 65. But if you're an active employee and you're over age 65, we refer to the third column, in which case, because you are still working, you are still treated as an active employee in a city health plan. You can, and it's advisable to enroll in Medicare Part A because now you're 65, and Medicare Part B and D are not applicable because as long as you're working, you do not have to enroll in Part B and D. Very easy. Let's go to the second row. The second row is about the subject for the second row is a spouse of a CUNY employee who is under age 65, or a DP, which is an abbreviation for domestic partner. So spouse and domestic partner. If you are the spouse or domestic partner and you are under age 65 of an active employee who is also under age 65, we would refer to the second column. your primary coverage for both of you is a regular active New York City health plan because the CUNY employee is still working, and Medicare is not applicable because both of you are under age 65. Okay. But if you're the under age 65 spouse or domestic partner of a CUNY employee who is over age 65, we would go to the third column. And in this column, it tells us that the primary coverage is still a New York City health plan because the CUNY employee is still actively working, even though they're age 65. And Medicare is not applicable because as long as the CUNY employee is working, they do not have to apply for Medicare Part B. But they can apply for Medicare Part A if they choose to. So those are kind of straightforward and simple. So now I'm going to go to a complicated one. I'm going to talk about the retired employee. So let's say you are a retired employee, a CUNY retiree, and you're under age 65. We would look at the second column. Your primary coverage is a New York City health plan because you're under age 65. You're still in an active plan. Medicare is not applicable because you're in an active, you're under age 65, so you're not eligible for Medicare yet. But let's say you're a retired CUNY employee who is over age 65, then we would refer to the third column. And in this case, now your primary coverage is a Medicare Advantage plan, which I'm gonna talk about briefly in a second. I know a lot of you are aware of this, but for those of you who are not, the Office of Labor Relations is implementing a Medicare Advantage plan and requiring all new retirees to enroll in that. They will no longer have the option of enrolling in one of the city health plans that you normally can enroll in as an active employee. So because the Medicare Advantage plan replaces both Medicare, traditional government Medicare, and a New York City health plan, a secondary health plan is not applicable. So because you're retired and over age 65, you must enroll in Part A Medicare, you must enroll in Part B Medicare. Part D Medicare, which is the drug coverage, is not applicable because it is provided to you by the PSC Welfare Fund, which Patrick is going to talk about afterwards. And because you're retired and enrolled in Medicare, you now are eligible to apply for a Medicare Part B premium reimbursement, which I'm going to talk about. When you approach your HR office and inform them of your intent to retire, the Medicare Part B reimbursement form will be part of that package, and those documents come to my office. So I hope that you understand how to read this grid, and that'll be and use it as a reference guide. It's not easy to comprehend a lot of this stuff because there's so many things going on at the same time, but I'm hoping that if you understand how to read it and the logic behind the way it was devised, then this chart should be able to answer a lot of your questions. And if it still doesn't, I understand it's complicated, and you can always reach out to your HR office. And if they are not able to respond to your questions, feel free to email me and I will help you as best I can. So I'm going to stop sharing this grid now and resume and go back to my slides.
Okay, there are a couple of questions coming through, so
Okay.
I will read them to you, and we'll try to just pick the ones that are general,
Okay.
specific. If you are a non-faculty and are not bound by teaching, do you have to request the form in November or March, or can you request it at any time? So I guess this is about Travia.
It's not a hard and fast rule about when to apply for Travia, but that's something that you have to coordinate with your supervisor, because ultimately they have to account for the salary that you're getting, because you're getting your full salary. So there's budgetary concerns there for them, and also, filling a vacancy if they can or can't afford to do that. So it's really a courtesy to your department to give them as much notice as possible. 4 months is a guideline. I mean, I know for whatever circumstances people have asked for Travia leave on a shorter notice, and they've been granted it. But that's, it's a courtesy and an understanding between you and your supervisor, and it depends on the needs of your department.
These are two questions about phased retirement. One says, please review the phased retirement conditions again for instructional staff. And the other one says, what is the age to be eligible for phased retirement, or is it only based on years worked full-time?
It's for instructional staff is age 62 and 15 years of continuous full-time service. So it's similar to being eligible to retire with retiree benefits if you're a TIAA participant. And so those are the rules for it. And did I answer both parts of the question? There's one more thing that I forgot to bring up that came up in the questions about teaching while on Travia leave. When you're on Travia leave, you can teach one class, a three credit class, and that's it. And also it's at the discretion of your college. So some colleges allow it, some colleges don't. It's not an entitlement, but it's something that you have to request, and the absolute limit is 3 credit hours.
Okay. Am I correct in understanding that if we want to start phased retirement for fall 2022, we have until the end of the semester?
You have until November 15. That's the deadline. I'm sure, a day beyond November 15 is not going to be, dismissed, but November 15 is the deadline.
Okay. Will they prorate partial days, hours for annual and Travia leave for HEO line if less than 160 days?
Can you repeat that?
Will they prorate partial days / hours for annual and Travia leave for HEO line if less
when
than
you're on 50 when you're on Travia leave, you're not accruing. You don't accrue anything. You do on phased retirement, but it's proportional to your workload. Okay.
And it should be noted that HEOs get half of their sick leave as Travia, right?
Yes.
So 160 days, you get
5 months.
Mm-hmm. Okay.
5 months. It's rolled up. It's rounded up to 5 months. It's not exact. It's a little short of 5 months, but if you have the maximum, it's rounded up to 5 months.
Correct. Someone wrote, on Travia in spring, is annual salary during July and August the reduced amount?
No, it's your full.
50% or 80%.
No, it's your full. For instructional staff, the summer after Travia is at full salary of annual leave.
On Travia, what does not count against Social Security mean? Was that on your slide? I don't know.
Yeah, I do. I think that it is on my slide.
Okay, we'll probably come back to that. Does the annual leave payout increase your salary for that year for pension purposes?
When you get paid out your annual leave, especially if you're in TIAA, when you're paid out your annual leave, it's pensionable earnings. So it does, yes.
Is it possible to take advantage of part-time option if I am not yet 65, even if school is open to it?
I don't know what that means.
Okay, me either.
That whoever asked that question, send an email to me and I'll address that offline.
I think the question is about phased retirement.
Do you want to read that again for me, Sandra?
It says, is it possible to take advantage of part-time PT option if I'm not yet 65? Oh, you think that's phased retirement? What they meant? Even if school is not open to it. I mean, even if school is open to it, yeah.
I think they're talking about teaching while on Travia because you're 65. I don't fully understand. I don't.
Yeah, we would need clarification. You could contact
me directly, email me directly, and I'll address that.
Transit benefit. Can you give contact information for the company that handles? Company was changed and swept by tragic pandemic events, lost info, and have not been able to identify new company.
It's Edenhead, and the information is on our website. Actually, I think that I have contact information on a subsequent slide.
Okay. If you are not 65 and want to do phased out retirement, can you apply when you're 63 or 64?
62.
62.
That's, yeah.
Can I do service unpaid doing Travia, like chairing, desertion, or some administrative work? I think we got this question before. My department chairs do not have the answer to this. Who else might I talk to?
If it's unpaid, then it's not really governed by the phased retirement policy. If it's paid, contact hours.
If you take Travia in the fall, do you get paid for the summer before? For example, if it's the spring 2022 and apply for Travia in the fall, will I receive my summer pay in 2022?
Yes.
I'm a HEO and my annual leave cap is 50 days, now 45. Would I be paid the full 50 days or would I have to spend down the extra 5 days?
For HEOs, it's 45. For ECPs, it's 50. So if you're 50 and you're a HEO, you have to spend down 5.
Okay, and there's a lot of questions about verification records. How to get, to whom do we approach about verification of service? Can we self-verify our record of service via Cuny first? This is for phased retirement, right?
No, that's for retiring in general. I mean, you should always contact the benefits person at your office.
Okay. And no self-certifying, right?
No.
Okay. How does buyouts work and who is eligible?
A buyout?
That's the question. I don't know what.
I'm not sure what they mean. I mean, I'm not sure if are they referring to a buyout waiver or are they referring to an early retirement incentive? I'm not sure what buyout means in this.
I have no idea. Okay. Maybe we'll get a more detailed question and then we'll answer it.
Okay.
There's a question about PICA drugs that will be addressed after Patrick does his section. If under 65, do we have to submit a new medical enrollment form to change to retiree benefits? GHI.
For GHI, no. For the other carriers, yes. But of course, this only applies to anyone who retires before December 31st, because anyone who's is retiring after December 31st of this year, it will not have the option of keeping the plan that they're in. They're only going to have the Medicare as a health insurance plan in retirement. And so unless they're retiring before December 31st, that question kind of is not relevant. But in general, broadly speaking, for those retirees that it does apply to, if you're in the GHI plan, then they automatically convert you to a senior care plan, when you turn 65 and you're retired and on Medicare. But the other health plans, you would have to fill out an enrollment form to switch you to a plan that is coordinated with Medicare. It's not automatic, but with GHI it is.
Yes, they're asking, do you have to still get in Medicare Part B and A, or do you have to pay Irma if you get on this Medicare Advantage?
Yes, you'll be enrolled in a Medicare Advantage plan, but you still have to apply for Medicare Part A and B and pay for it. Pay for B. It's reimbursable to you, which I haven't, which I'm going to get to, hopefully. And Irma is reimbursable to you as well. But you do have to Medicare Advantage plan is like an all-inclusive, but you still enroll in Medicare Part B and pay for it.
Someone said, I started at Cuny in 1997, left in 2012, and returned in 2017. This breaks the continuous 15 years. Thus, am I not eligible for health care?
Right. So that is a considerable break in service. The 15 years for retiree health insurance, if you're in TIAA, has to be continuous.
There are a lot of Medicare Advantage questions, and I think we need to hear Kim Parker's presentation.
I have a brief slide on it also, but
okay,
not too much detail, but I'm going to touch on it.
Okay, good. Do you want me to, all these questions are Medicare Advantage. Do you want to go back to, you have slides to continue, right?
Yes, I have more slides to continue.
Okay. There is one question here.
Okay.
What if you have a dependent, a child for whom you have guardianship, not a spouse, who is covered by your plan? Do you just read the chart as if it were a spouse?
No, if you're even if the only if you're a guardian, a legal guardian of a child, then they can't be covered under your retiree health plan. I'm not sure how. They wouldn't be on a Medicare Advantage plan. They would probably have to be on active plan. I don't know. That's kind of a new scenario that we're just starting to think about. But I can say that if you have a disabled child that's on your plan, that meets the criteria of a permanently disabled child who is on your plan, that chart will apply to you as if it was a spouse, because they're eligible for being on your retiree plan, and they're also eligible for a Medicare reimbursement because they're most likely on Medicare as well. They're also eligible for a Medicare Part B reimbursement, similar to a spouse, as long as they are designated permanently disabled.
Okay. I'll let you get back to your slides, Talene, and then we'll continue with that.
All right. Thank you. So this next slide just refers to Medicare Part D, which Patrick is going to talk about. And the only thing I'm going to say about it is that do not roll in Part D. So the Medicare Part B reimbursement is a benefit to Cuny retirees. There's a basic Medicare premium that is reimbursable to you. You would apply for Medicare Part B within 3 months of either turning 65 or retiring, or whichever, when both of those things are true.
I'm sorry to interrupt, but did you intend to share your screen again?
Oh, I didn't? I'm sorry.
Okay.
I thought I did. Oh, I didn't hit that last button. Do you see it now?
Yes, we do. Thank you.
Okay, good. So, Medicare Part B reimbursement is a retiree benefit for Cuny retirees. There are conditions to it. You have to be enrolled in a city health plan. For those of you retiring after January 1, that would be the Medicare Advantage plan. And you have to be living in the United States. But you can have your Medicare Part B reimbursed to you as well as your spouse or a disabled adult child. Oops. I'm just going to touch on the Medicare Advantage plan quickly. The Medicare Advantage plan is going to be required of all retirees from Cuny who retire on or after January 1, 2022. It is administered by Alliance and Emblem Company. The Medicare Advantage plan will cover any service performed by a doctor who accepts Medicare and hospitals who accept Medicare. It's a no premium plan, but there are copays copays associated with it. And even though you're on a Medicare Advantage plan, you're still required to enroll in Medicare Part A and B. So when you apply for Medicare Part B reimbursement, if you're in NYCERS or TRS, this is the link where you would upload your documents, where you would find the forms on the OLR website, and this is where you would upload the documents that are required, and your Medicare Part B reimbursement will be directly deposited into the same account where you get your pension check. If you are a TIAA participant, this is where you would send in your form, and the form will be given to you by your benefits person when you have a retirement consultation with them. It'll be part of your retirement package of documents, and this is where you would send it to our office, and we manage the TIAA Medicare Part B reimbursements. And then there's the Irma, which is income related. I don't have a chart of what the threshold is for your income level that requires you to pay an Irma premium. But when you receive Social Security statement in November or December of the year that refers to the upcoming year, when they send you a statement of what you can expect to receive in your Social Security, it will also give you the detail of what you will pay for Medicare Part B. And if you're subject to Irma, that will be listed as a separate line item on that Social Security check. So if you are subject to Irma, your Irma is also reimbursable to you. It's done on a different timeline because it's income related and your income can fluctuate from one year to the next. You have to apply for Irma annually. But the basic Medicare reimbursement, once you are set up to receive that, you will get it automatically every spring, usually April. Irma is usually paid in October. This year, they're very behind, and they paid it, over 2 months. So some people haven't received it yet, but you will get it nonetheless if you're subject to it, and it'll be the full Irma amount for both you and your spouse and your dependent permanently disabled child if it's applicable. So the transit benefit is, for those of you who participate, is administered by Edenred. Here's the contact information for Edenred. If you participate in the transit benefit, the only way to spend those funds is to purchase transit passes, tickets, and for the railroads and MTA, buses, New Jersey Transit, whatever the case may be. You only have 90 days to spend down those funds from your termination date. So your termination date would be your retirement date. It wouldn't be the date that you're on Travia or phased retirement because you're still receiving a paycheck. But once that final annual leave period ends in July and August, and you hit your actual retirement date, the end of August, you have 90 days to spend down those funds. So if you're paying a discounted rate on your transit for your transit passes, you should think about reducing what you put in this transit account, because there's no way to get a refund if you've put too much money in it. And I know with COVID, some people have forgotten to reduce the amount of money that they put in their transit accounts, even though they stopped commuting regularly. So you should contact Edenred, find out or figure out there's information on our website about how to create a login for yourself so that you can see your records. You should see what your account balance is and start planning for spending it down, because you'll only have 90 days to use it after you are separated from Cuny. The healthcare flex spending accounts. This is a use it or lose it program as well. You should look at what is left in your account, consider spending it down. There are some options about how to remain in the plan after you leave. If you have so much money in there that you're not going to be able to spend it, there's a way for you to remain in the plan up until December 31st of the year in which you retire. And you have a few options here that your campus benefits person can help you with, your benefits officer can help you with. I won't go into the detail about that, but if this pertains to you, you should contact them and coordinate how to spend down those funds, because there's no way for you to change the amount that you're contributing. You can only produce receipts to spend that money, spend it down. The New York State Deferred Compensation Plan is an investment vehicle that's available to you. It is over and above any tax-deferred annuities you may have with TIAA or TRS. The amounts that you put in those two accounts are not coordinated. Normally, with tax-deferred annuities, you have an annual limit of what you can contribute. But if you have a New York State deferred compensation plan, you can effectively double what you contribute to your TDA by contributing to this plan as well. The rules for withdrawal are slightly different. And if you are still a year or two away from retirement, you should contact them and think about how to maximize your retirement investments and sock away as much money as you can on a pre-tax basis while you're still working. So even if you're a couple of years away, it's not too late to participate in this plan. And I highly recommend that you do if you would like to defer funds over and above what you're already putting in your tax-deferred annuity, or if you're maxing on it. Retirement counseling, as Sandra talked about earlier, you should make appointments with either Sandra or your pension system, your HR office, to talk about everything, to make sure that you are an educated consumer, that you have all the information you need, and that you go to it with eyes wide open. So there are tons of people that are at your disposal, and you should take advantage of them. Working after retirement is an option for some of you, but there is an earnings limitation. If you retire before your full retirement age, which is 65, and you are limited, if you're collecting a pension, you are limited to how much you can earn if you go to work for another New York City or New York State agency. So there's a $35,000 earnings limit. If you exceed that, your pension will be suspended. The exception is if you're over age 65, there's no limitation. And if you go to work, if you're under age 65 and you work for the private sector or an agency in a different state other than New York, then that earnings limitation doesn't apply. So it only applies if you retire under age 65 and you want to work for another New York City or New York State agency. 35,000 is your earnings limit. Don't forget to keep everyone updated on your address changes. Unfortunately, all of these different systems don't talk to each other. We don't really share information. So your human resources office doesn't give your new address to TRS or TIAA or the PSC Welfare Fund. These are all entities that manage their own databases. And so you should remember to update your address with all these different entities, especially if you change your bank because you're getting a pension into your bank account, or you're getting your Medicare Part B reimbursement directly deposited into your bank account. These are all reasons for making sure that everyone that you deal with as a Cuny employee have updated records to contact you for any reason, and that includes email and telephone numbers. And the last thing I'm going to say is remember to notify these different entities of beneficiary changes. There are life changes that happen at this stage in your life. There's marriages and divorces and deaths, and beneficiaries can be affected by that. So make sure that your marital status is also updated with, especially your pension system, if it's TIAA, and anyone else that you think should be aware of your marital status change. The health insurance carrier, anybody you could think of. And these are just some links to common websites that you can utilize. And maybe we can go back to the Q&A now.
Okay, so there are a lot of questions coming through for phased retirement because I think something that was said versus what the slide showed about the age. So is it age 62 or 65 and 15 years?
My slides, let me look really quickly. My
Slide says 65.
Oh, I could have misspoken. I have to verify. I could have misspoken on that.
The slide says 65, right?
Yeah, it does say 65. I believe it's 65, but I'll check and verify that.
Okay. Is there an early retirement incentive?
Not that I know of.
If you retire at the end of spring semester, do you receive salary over the summer?
If you retire at the end of the spring semester,
I think that means Travia, spring Travia.
It depends. Well, if it's Travia, if you took the Travia in the fall, you don't get, you retire at the end of January before the spring semester, and then you don't get annual leave paid out. But if it's not Travia related, if you work in the fall and then you retire right after that, dismissing Travia or phased retirement or anything, you'll be eligible for 1 month of annual leave in the subsequent summer. So you have to work in the fall and the spring to get a full summer of annual leave. If you only work in the fall, you only get 1 month of annual leave in the subsequent summer.
Library faculty work a 12-month contract. Can we take Travia at any time?
For non-teaching instructional, yeah, Travia is a little more. It's if you have the full 160 days, it's a 5-month period, but it doesn't have to be consistent with the academic year, the way that instructional staff.
Okay. Because of the pandemic, I did not use the transit benefit and won't use it in the Travia Spring 2022. Do I lose remaining money in the red account?
You have to, the only way to use it is to spend it down by purchasing tickets. I mean, if you don't think you're going to be able to use it, you're going to lose it after 90 days. I mean, if I had to give you advice on that, I would say, buy tickets for all your relatives. Like spend it, or, that's the only way to use it, is to spend it down by purchasing commuter tickets. And I did verify, it is 65 age. I misspoke. It was not 62. It's 65 for phased retirement. I apologize.
65 and 15 years.
15 years.
Or more.
Mhm.
Once your phased retirement plan has been approved, which includes Travia semester, do you need to apply separately for Travia leave?
No, it's part of it.
Can you start phased retirement in spring semester? For
No.
example, offspring teach fall. When is the
No.
deadline for applying?
Phased retirement can only begin in the fall semester.
So there are a lot of questions about traditional Medicare, and I think, we'll address those after Kim Parker talks. But you emphasized during your part, Celine, that the option is Medicare Advantage and that everybody needs to apply if they're 65 and older still for Medicare A and B,
Right.
along with, just to clarify, because there's so many questions coming through.
Yes.
Celine, can you read a question that Naomi put in the chat for you? And then maybe we could address it. Just, that's a question for you, and then we could address it.
The ability to opt out of the Medicare Advantage plan, is that not your understanding? I mean, I have to be honest with you. There's so many changes taking place with regard to this Medicare Advantage plan, because there's been so much upheaval and so much, there are lawsuits and negotiations going back and forth between, OLR and PSC and this and that. If it's changed recently, then I was not aware of it. I didn't think that anybody hired after January 1 had the option of staying in the GHI senior care plan. Perhaps that's changed. I feel as though things are changing almost weekly. So I'm not going to say I'm 100% certain about that, but that was my understanding, was that anyone retired on or after January 1, 2022 wouldn't have the option of the senior care plan, but perhaps that's changed in the last few days.
And this is coming back. I think you skipped my question. What if I have insurance through my spouse's insurance via the buyout program? I don't know what buyout program.
Oh, the buyout waiver. So they've waived health insurance. They're on their spouse's plan.
So the question is, when do I have to choose the Cuny insurance plan? At what point? Pre-retirement date?
If you want to, as a Cuny retiree, if you're eligible for retiree health, you don't have to take it as soon as you retire. You can stay on your spouse's plan if that works for you. And then, 2 years later, you can come back and say, okay, now I'm ready to enroll in my own retiree plan. The problem with that is that you can't just do it at any time of the year. You'll have to wait for it. There has to be a qualifying event, such as your spouse stopped working and so you're losing that coverage, or you have to wait for an open enrollment period or a transfer period in October and November with an effective date of January. So you don't have to take the retiree health immediately upon retirement. It's available to you to come back to in the future, but then you may be limited as to what the effective date could be.
Okay. So can you use transit benefit for New York Trailway bus? I don't see that on the website.
Oh, like Adirondack Trails or something. I'm not sure. I'm not 100% sure that we would have to find out.
Okay. And then there's another one about transit. Since MTA has issued half fare cards, which are not transferable, is there any way to buy separate Metro cards? I'm going to lose so much money.
I mean,
you can buy separate, right?
You can buy a Metro card with your transit money. Yeah.
I have been a department chair and received a summer supplement for work over the summer. Does this count toward pension? I don't know
It's,
what.
it's not, that's not paid through tax levy, I believe, right? If it's not through tax levy, then it's not.
Once fully retired at full retirement age, what happens to health coverage for dependent, spouse, and minor?
When you reach full retirement age, what was the first thing?
Yeah,
Sorry.
once fully retired at full retirement age, what happens to health coverage for dependent, spouse, and I guess a minor child?
Well, you would, the CUNY retiree would be on the Medicare Advantage plan, but if the spouse is under 65 and the child, is obviously under 65, they would be on a separate active, they would be able to remain on the GHI plan, assuming that's what they're on.
Okay.
They would not be eligible for the Medicare Advantage plan.
Can I change to 100% payroll deductions from my paycheck for my TDA contributions when Travia leave starts?
No. We
I
get
do.
this question all the time, and OSC does allow us to put in 100%. There's a pecking order of other deductions that have to come out, and if for whatever reason there wasn't enough money after the 100% TDA, if there aren't enough funds left over to cover whatever other deductions are in place, then the entire TDA contribution is rejected. And so now you've gone a pay period without contributing anything. Like the rule of thumb is 50%. I've seen as high as 75%, but you have to be really careful about exceeding, making sure that there's enough money after the TDA contribution to pay for all the other required deductions. So it's tricky.
How are my benefits impacted if I move out of town?
Out of town, like out of New York City?
I think.
How are your
State.
benefits affected as a retiree? If you're on the Medicare Advantage plan, the plan accepts all doctors who accept Medicare, and that means nationally. So if it's a Medicare Advantage plan, it wouldn't matter where you lived as long as you're in the United States.
Okay. Can you take phased retirement for different amounts of time?
No, it's a very structured plan. It's increments of 1 or 3 years, and that's it. There's no flexibility there.
I'm on my spouse's plan, and my college rep is firm that I have to take a city health plan to get retirement benefits. Please advise.
You have to be in a city health plan in order for your Medicare Part B to be reimbursed to you. If you're not in a city health plan and you enroll in Medicare Part B, it's going to be an out-of-pocket expense for you, and it's not reimbursable.
Okay. This is a question about PSC membership dues, and Bill Friedham will talk from the Retirees chapter towards the end of this conference. So he's going to address membership as a retiree.
Okay.
Let's see what else is here. I thought I had to be on the CUNY health plan to be eligible to enroll in the CUNY Medicare Advantage plan pre-retirement. Is this no longer the case? So I think it's about now being on the CUNY benefits, retiring, and having to get on the Advantage.
If you're retiring, I don't really understand where the question is going, but if you're retiring and you're under age 65, you're still going to be on the same health plan that you're in as an employee. It's only when you turn 65 that you go to a Medicare Advantage plan.
Right. But let's say they're retiring and they haven't been on the CUNY health plan. They were on their spouses. And they have the ability of retiring with benefits from CUNY.
Mm-hmm.
So I think that's the question about how this whole CUNY Medicare Advantage.
If you're on your spouse, so the thing is, If you're on your spouse's plan, that's fine. You can, and as long as you meet the eligibility, you can come back a couple years later and say, okay, now I'm ready to enroll in the Cuny retirement. But if you're on your spouse's plan and you apply for Medicare Part B, it's not going to be reimbursable to you. That benefit is not available to you unless you're enrolled in a city plan, which in this case would be the Medicare Advantage plan. So they would lose that benefit. Patrick can address it. I believe that they can still have the welfare fund benefit. They can enroll in just that and not the health. But
he'll address that, yeah.
Right. The Medicare Part B is not reimbursable to you unless you're in a city health plan. So if they're on their spouse's plan and that's all they have and they're not on Medicare, that's fine.
So there's a couple of questions coming through for this, the Metro and what they could buy with the card. So where can they find out what's eligible to purchase? Because this one is asking for Amtrak in PA, also New Jersey Transit. Can I buy tickets?
Yes, those are all public transportation is included in that. So the MTA, Amtrak, New Jersey Transit, yes, public transportation can be used for any public transportation.
And again, there are a lot of questions coming through about this Medicare Advantage. Are there alternatives outside of the Medicare Advantage plan?
No.
Okay.
I can add, I just noticed that Kim put a message in the chat. Kim says, folks that retire next year will have the choice of Medicare Advantage or the GHI senior care, but be aware there's a cost to senior care. It's about $200 a month. Medicare Advantage, of course, is free.
Can I just add that it's $191 for the employee, but if there's a spouse, it's an additional $191. It's not just $191 for both.
Right.
According to the rate chart.
That's correct. Yeah.
Okay. Thank you. We keep hearing doctors are not accepting Medicare Advantage. I think we will address the rest of the Medicare Advantage questions after Kim speaks.
I think Kim was better to address that question.
Yeah, the Medicare Part B reimbursement applied to my spouse. Anything,
if they're on your retiree health plan, yes.
Okay. What else? Do you have to be tenured to qualify for phased retirement?
No. The requirement for phased retirement is age and service, years of service. It's not about whether you're tenured or not.
Okay. And I have 75 days of sick leave. Half of that is 37.5 days. Do they round up to 38 or prorate the half day for Travia pay?
I no.
Do they round up or down? I don't know.
I don't know. That's a question for the timekeeper. Their timekeeper at their campus. I don't know how they deal with half hours or half days or whatever.
Will PSC reimburse Medicare Part B premium and Irma if we opt for senior care and not Medicare Advantage?
If they opt for, it's not the PSC, it's the LAR. If you remain in the GHI senior care plan, you're still eligible for the Medicare reimbursement. You're paying to be in the GHI plan, and you're paying for Medicare, but you're still eligible for the Part B reimbursement.
Okay, and this is one about the lifetime annuity with TIAA. So if Medicare Advantage is free, do your pension continue the $50,000 when you retire from TIAA?
That requirement has not been lifted given this new Medicare Advantage plan issue. So that has not changed. You're still required to reserve $50,000 and annuitize a minimum of $10,000. Because I just want to say, just because the Medicare Advantage plan is free this year is not a guarantee that it'll be free into the future. So that annuity is there in order to ensure that whatever premiums are charged will always be covered, so that there's never a loss or a lapse in coverage. So those requirements have not changed yet.
Okay. Would Travia be available to a CLT hired full-time in 2017, but has a total of 17 years of accredited service for part-time work since 1992? I am in the TRS plan. So there are a couple of questions that came through about Travia and whether you could take Travia based on when you were hired. Can you discuss that?
I believe Travia requires you to be full-time.
Okay, so maybe they could email.
Yeah, let them email me and I'll look into it further.
Okay, and then what is the criteria for being able to take?
Oh, by the way, Travia. Oh, go ahead. I'm sorry. Go ahead.
No, go ahead, Kelly.
No. No, it's okay. Finish your question.
So the question is, what is the criteria for when it comes to time frame for being able to take Travia? Do we have to be hired?
How much advance notice?
No, hired. When were they hired in? So I think the question is
the eligibility for Travia. The eligibility for Travia is based on the TRS rules for retirement. So depending on the year that you were hired, what tier you're in, if you're a tier 6, to take Travia leave, you have to have 10 years of service and be age 62, I believe.
Yeah.
So it's based on the tiers and the rules for retirement for TRS. Even if you're not in TRS, even if you're in TIAA, the eligibility for Travia is based on the TRS retirement rules.
The tier, right. Can my Travia leave be reduced because my workload caused me to owe the college 1 hour?
I don't know. They can email me and I don't know what that means. They owe you an hour. I don't know what that means.
Okay. I think when can I roll over a small amount of money from TIA to my TRS? Okay. The person that asked that question, you could email me and I'll put my email and we could discuss. And I think that's it, Taline.
There's 204 more questions.
Well, I'm answering a lot of them. Most of these questions, believe it or not, are Medicare Advantage. Okay. So I think we need to wait for Kim Parker to do her part and then maybe address all these Medicare Advantage questions.
Okay.
Okay.
Well, thank you for having me. And I'll stay on if there are additional questions. I won't log off yet.
Thank you. Naomi, were you going to address?
Yes.
Okay.
So we, it's not on your agenda, but we decided to incorporate a 15-minute break into the agenda. It was intended to start at 11:45, but we're at 11:50 now. So we'll start it now and return at 12:05. And then you will have Kim Parker from the Alliance available to answer your questions about Medicare Advantage after she does a brief presentation.
Thank you, Naomi, and thank you everyone at PSC Cuny. My name is Kim Parker, and I am from Empire Blue Cross Blue Shield, and I am the account executive that's responsible for the Medicare Advantage Plus program that is being offered to the City of New York and the City of New York retirees. So the purpose of today's presentation is really just to give you a high-level overview of how the program works, specifically how it compares to traditional Medicare and the senior care plan. And I anticipate that we'll spend most of the time at the end of the presentation answering many of the questions that have come in. So moving right along. On this slide, it gives a high-level overview of how a Medicare Advantage program works in general. So under a Medicare Advantage program, we're contracted with the federal government to cover Medicare benefits. So currently today, under original Medicare or traditional Medicare, it's divided into two parts: your Medicare Part A benefit, which is your hospital portion of Medicare. And as long as you've worked 40 quarters, you qualify for Medicare Part A without a premium. So you automatically get it when you turn 65, as long as you've worked for 10 years in the Social Security system. Your Medicare Part B benefit is your medical portion of your Medicare coverage. And the Medicare Part B benefit, there is a premium that the federal government charges for the Medicare Part B benefit, and that comes directly out of your Social Security check. And for 2021, it's roughly $148 for the base Medicare Part B premium. Depending on your income levels, the Medicare Part B premium could be higher, depending on which income bracket you fall into. But as it was mentioned earlier, as long as you're enrolled in one of the City of New York qualified medical plans, you will be reimbursed for that full Medicare Part B premium, including any income-related surcharges if you're in a higher income range. So your original Medicare is divided into the two parts: your Part A hospital benefit, your Part B medical benefit, and then you would have a secondary or supplemental plan that would pay after Medicare pays, and that would be the GHI senior care plan. So under the Medicare Advantage program, we're taking all of those pieces and rolling it together into one combined program. So it creates a simplified experience for the member because you have one single identification card and you'll receive one single explanation of benefits. Under the original Medicare and GHI senior care arrangement, you would receive explanation of benefits from Medicare and then an explanation of benefits from GHI for medical services, or an explanation of benefits from Empire for the hospital benefits. So by combining all those pieces together, as I said, it's the one single identification card and it's the one single explanation of benefits that you'd be receiving. Now, as a Medicare Advantage carrier, we're contracted with the federal government to cover everything that's covered under traditional Medicare. So as a base minimum, everything that's covered under Medicare Part A and Part B benefits must be covered under the Medicare Advantage program. So we follow the same Medicare coverage guidelines that are in place under traditional Medicare. And we also follow the same Medicare medical necessity guidelines that are in place. So if it is a Medicare covered service, it will be a service that's covered under the Medicare Advantage program. Now, in addition to all of the Medicare services we're required to cover, there is also a whole host of additional enhancements or additional benefits that come under the Medicare Advantage Plus program that are not covered under original Medicare or the GHI senior care plan. And I will just go over a high-level review of what those enhancements are on a few slides later. In regards to the network of providers, The New York City Medicare Advantage Plus program is a national PPO program, so it is portable. You can have this program in any of the 50 states in the United States or U.S. territories. So it is a national program. So whether you live in New York, California, Florida, or the U.S. Virgin Islands, this program will cover you. The program, as I said, is a national PPO program, which provides you coverage and access to any Medicare participating provider. So under the program, you will be able to access any Medicare participating provider nationally. Now, we also do have a network of in-network providers that are contracted with the Blue Cross Blue Shield Association. So if you see an in-network provider, they would be contracted with either Emblem Health, Empire Blue Cross Blue Shield, or any one of the various Blue Cross Blue Shield programs that are located throughout the country. So for example, if you live in Florida, the Blue Cross Blue Shield program in Florida is Blue Cross Blue Shield of Florida. If you're in New Jersey, it's Horizon Blue Cross Blue Shield. But because this is a national passive PPO program, you have the ability to see in or out of network providers, and the benefits will be the same for the member. So whether you see an in-network contracted Blue Cross Blue Shield provider or an out-of-network Medicare participating provider, that claim from a member's perspective would be the same. So you have the freedom to go in or out of network. Specifically in the New York market, we have all of the hospitals participating in the network. So the majority of the providers that City of New York retirees are using today are actually in-network contracted providers. We are in the process of a full-fledged provider education campaign to ensure that every provider in the market is aware of the New York City Medicare Advantage Plus program, and that they have all the information they need to be able to address questions that come in from their patients. I mentioned earlier that there's a whole host of enhancements that come with the Medicare Advantage Plus plan that you would not receive under traditional Medicare or the GHI Senior Care Plan. Just to briefly go through a few of them, there is the Silver Sneakers benefit, which is the free gym membership that's included in the plan. We also offer non-emergency transportation. Members will have 24 one-way trips to and from their doctor's appointments, pharmacy, or the hospital. So this is basically a car service that will be able to take you to and from your doctor's appointments. There's also a telemedicine benefit that's a zero copayment. We also have healthy meals. Members will receive up to 56 meals delivered to their home post-discharge from the hospital. There's also a pantry benefit that is developed to help members manage certain chronic conditions better. We also have the Wellness Rewards program, where we're going to offer gift cards and incentives to the members who are doing their preventive and wellness screenings. So members have the ability to earn up to $200 in gift card rewards for doing preventive screenings like their annual physical, colonoscopy, mammography, their annual health risk assessment. Another very important component to call out is the fact that the Medicare Advantage Plus program covers you worldwide for urgent and emergency care. And this is important because traditional Medicare does not cover you outside of the United States. So under the Medicare Advantage Plus program, you will have worldwide coverage for urgent and emergency care. There's also the health and fitness tracker, which is basically a free Fitbit that members will be eligible to receive every 2 years. There's also a hearing aid benefit that's included in the program. So there's a whole host of additional benefits and services that are not covered by traditional Medicare that would be covered under the Medicare Advantage Plus plan. Now, just to give a high-level comparison between the New York City Medicare Advantage Plus plan and the 2022 GHI Senior Care Plan. Now, these will be the two options that will be available to retirees after January 1st, 2022. So you will have an option between the Medicare Advantage plan or the GHI Senior Care Plan. Now, the Medicare Advantage Plus program will be the premium-free option that the City of New York will be offering to Medicare-eligible retirees and their Medicare-eligible dependents. So the Medicare Advantage Plus program does not have a premium, and it will be premium-free, guaranteed for the length of the 5-year contract that's in place. So for a guaranteed 5-year period, you know that the Medicare Advantage Plus plan will be zero premium for you. Now, the GHI Senior Care Plan is also an option that retirees will have to choose from for after January 1st, 2022. Now, the difference between the two programs is the Medicare Advantage Plus plan is the premium-free option. The GHI Senior Care Plan does have a premium, and for 2022, the premium would be $191.57 for the basic coverage, and then $2.83 for the 365-day hospital rider. So it's $194.40 per member per month. So if you have a Medicare eligible retiree and a Medicare eligible spouse, that would be approximately just under $400 for the cost of this plan on a monthly basis. Now, if you do have a spouse or dependents that are not Medicare eligible, those non-Medicare eligible dependents would be covered under the GHI CBP plan. So that is the companion plan that goes with both the senior care plan as well as the Medicare Advantage program. So if you're in the Medicare Advantage plan, your non-Medicare eligible dependents would be covered under the GHI CBP plan. Now, in regards to the annual deductible under the Medicare Advantage Plus program, there is a $253 deductible for the year, and that's combined in or out of network. So it means the first $253 in medical expenses the member would be responsible for. Under the GHI Senior Care Plan, the way the deductible works is the Medicare Part B deductible, which is $217 for 2022. And then there's an additional $50 plan deductible. So the combined deductibles under senior care would be the $267. There is an annual maximum out of pocket under the Medicare Advantage Plus program. And this is your safety net. This is the most that you would pay in out-of-pocket expenses between your deductible and any of the co-payments that you pay. So once you reach the $1,470, there are no additional co-payments that you would have to pay for medical services. Under the GHI Senior Care Plan, the maximum out-of-pocket is unlimited. So there is no catastrophic cap or protection. So your co-payments can continue indefinitely. So there's no maximum cap that you would have on your co-payments under that plan. Under both programs, there is a $300 co-payment per admission for inpatient hospital stays, and there is a $750 per person maximum per calendar year. So if a member has 3 separate hospital admissions in one calendar year period, the most that you would pay would be the $750. Both programs cover skilled nursing facility care at a zero copayment for days 1 through 100. And this is the full Medicare benefit period, is the 100-day period for skilled nursing care. Your primary care physician visits, however, is slightly different between the GHI Senior Care and the Medicare Advantage Plus plan. Under the Senior Care Plan, it would be a $15 copayment for your primary care physician. Under the Medicare Advantage Plus plan, it is a zero copayment. Under both programs, all specialist visits would be the $15 copayment for any specialty visits. There's also an emergency room copayment of $50. Under the Medicare Advantage Plus program, if you're admitted into the hospital within 72 hours of that emergency room visit, that ER copayment is waived and you would not be responsible for that $50 copayment. A dialysis is also covered under the program at a zero copayment, and that's dialysis, whether it's done in an outpatient setting or dialysis in the home. This is just a brief high-level summary comparison between the two programs. The Office of Labor Relations does have a much more comprehensive side-by-side comparison of the program posted on their website. So I encourage all retirees or active PSC Cuny members considering retirement to review the documents that are located on the Office of Labor Relations website. I did want to briefly touch upon the prescription drug benefit. For those retirees that don't receive their prescription drug coverage through their union welfare fund, you have the ability to purchase the high option drug rider. The high option drug rider that would go along with the Medicare Advantage Plus plan or the GHI Senior Care plan is administered through Emblem Health, who is the current administrator of the high option drug rider today. And the 2022 premium for the high option drug rider is $125 per member per month. I did mention the Office of Labor Relations website. They are housing a whole host of important information and resources. So if you view the Office of Labor Relations website, you'll be able to see the frequently asked questions document, as well as the plan comparisons for all of the programs, the 2022 rate sheets, as well as the health benefit application or the ERB form that's located on the Office of Labor Relations website. If you have any specific questions about the New York City Medicare Advantage Plus program, we do have a pre-enrollment call center that is open and available to answer questions. So you can call the 833-325-1190 phone number to ask any preliminary questions about the specific benefits of the New York City Medicare Advantage Plus plan. So I am complete with the presentation. I wanted to just give a high-level overview. I know the more important portion of this is the questions and answer session. So I am going to stop sharing. And I believe that, Pat, you are going to be, monitoring the Q&A session, and I'll be more than happy to answer everything I possibly can.
All righty, so let's go into it. I'm going to scroll up to the top here. So, will future retirees, that is someone who retires in January 2023, have the same options as the current retirees who are already retired now?
Post January 1st, 2022, the retirement options that the City of New York will have in place for Medicare eligible retirees will be the New York City Medicare Advantage Plus plan or the GHI Senior Care plan. So as of right now, for 2023, that's the plan.
Okay. If a current retiree opts out of the Medicare Advantage Plus, can they join it a few years down the road, paying the same premium as those who joined it from day one, which is $0?
Yes. So the member will have the ability to enroll in the Medicare Advantage Plus plan or switch back to senior care during the fall transfer period. So the City of New York is opening the fall transfer on an annual basis. So they'll be able to switch between plans on an annual basis, and the premiums will always be the same regardless of when the member made that choice.
Right. Should we continue with our major medical plan, or is that covered by Medicare Advantage? I'm not exactly sure what that means. If your current insurance is your insurance now until you retire, unless you want to change it, but it doesn't have anything to do, Medicare Advantage is not available to you until you retire. I hope that answers that question. Can you retire before 62 and keep health benefits if Travia continues past 62? You've got to be 62 by your date of retirement. okay? So if you turn 62 during Travia, you're good because you're still on your basic health plan while you're on Travia. Keep going. It sounds like Medicare Advantage has only national coverage. Should we retire and live internationally? Would we have any medical insurance? I think only emergency, right? Am I right in that, Kim?
Correct. So what you can do is, in order to be eligible for the Medicare Advantage Plus program, you cannot be outside of the United States or U.S. territories for more than 6 months. So if you're looking to permanently move abroad to live in Europe or Israel, for example, on a permanent basis, Medicare does not cover you outside of the United States either. So what will happen is, there really isn't any coverage. It would be limited under the Medicare Advantage Plus plan. You wouldn't, during that 6-month period. If you come back and forth, this is a very long-winded answer, I'm sorry, but I know that there's a couple of, this has come up before. So if you are out for 6 months and you come back to the United States, you can be in Medicare Advantage, but it will only cover you for urgent and emergency care. But keep in mind, under traditional Medicare and the GHI senior care plan, you wouldn't have any coverage at all.
Right. Are there alternatives available to the Medicare Advantage plan? Yes.
The alternative would be the GHI senior care plan.
GHI senior care at a cost.
Correct.
We keep hearing doctors are not accepting Medicare Advantage plans.
Well, when this was initially rolled out, there was, I will be very candid, there was confusion amongst the provider community. And a lot of it was tied to the fact that the city wanted a custom plan name. So this is a custom plan created specifically for the city of New York. So that New York City Medicare Advantage Plus plan name is custom for the New York City plan. Providers were not familiar with that plan name. Since then, they have become very familiar with that plan name. Over 91% of the providers that city retirees use today are in-network contracted providers familiar with the plan. So I think that the messaging has changed drastically over the past few weeks because the majority of providers that are out there and city retirees are using will accept the plan. They're either actually contracted in our network or they've seen members on an out-of-network basis and bill the plan directly. So there shouldn't be an issue in regards to any member accessing providers that would accept the plan.
Okay. And this is a reiteration. If I'm retiring in North Carolina, what are my options? Well, Medicare Advantage plan is national. And GHI, if you take GHI senior care, it also works there. It's also, we have Cuny retirees all over the country who are currently enrolled in GHI senior care. The Advantage plan may accept all doctors, but is the reverse true? We've just talked about this. Doctors are not required to accept anything, but we expect they will accept this. Why do you have to be in a city health plan if Medicare Advantage is our health plan? It's a city plan. Those city health plans have a wide variety of premiums, but my understanding is that Medicare Advantage doesn't have any premiums. Well, there are those two, and the GHI senior care will be $191.57 per person per month. Medicare Advantage has no premium. Okay. Indiana does not accept New York City Medicare Advantage. I don't think that's true.
That shouldn't be true at all.
Should not be true. So if Medicare Advantage is free, does your pension still? So this is the TIAA health insurance annuity issue. if Medicare Advantage is free, do we still have to annuitize $50,000 or between $10,000 and $50,000 of our TIAA accounts for health care? Sandra,
Yeah.
you want to address that one?
It's business as usual. Nothing has been determined regarding the lifetime income annuity. So before the Medicare Advantage plan, and it was just GHI Senior Care or any of the other city pension, health plans that someone picked, even if it's a zero payment, out of pocket for this health plan, members with TIAA still were required to set aside $50,000 from the optional retirement plan and annuitize a minimum of $10,000 into a lifetime income annuity. The specifics of which you will discuss with your TI advisor or TI consultant, single life, joint life, guaranteed periods, all that stuff. They do illustrations for you. But you have to set this up even if you have zero pay to Office of Labor Relations. So in this case, all of you with the Medicare Advantage plan, which Kim has emphasized is zero cost, you will still need to proceed and annuitize $10,000 from your ORP, optional retirement plan with TIAA. You need to leave $40,000 remaining in that ORP account in reserves. And then you proceed with discussing with your TI consultant about your rest of your monies in the rest of the ORP or your TDA accounts or other accounts that you may have with TIAA. So as it stands, OLR and TIAA and Cuny, no determination has been made. Nothing has changed when it comes to this requirement.
Okay, thank you. Here's one for you, Kim. If I am enrolled in my spouse's Oxford plan as secondary coverage in addition to my GHI, will that adversely affect my enrollment in Medicare Advantage when I turn 65?
Assuming that the Oxford plan is not a Medicare Advantage program, it will not have any impact. So what will happen is the enrollment will be into the Medicare Advantage Plus program will be the primary coverage. And then the Oxford plan can stay in place as a secondary plan. They may or may not coordinate with the plan. It depends on how the program is set up. So you could try to submit co-payments as a secondary to the Oxford plan to see if it would cover anything. But typically, the way those programs work, it typically does not. So just keep in mind that the Medicare Advantage Plus plan is the primary benefit, and your spouse's coverage could be kept in place as secondary. I do want to specifically call out the Empire plan or NYSHIP, because we do have quite a few City of New York retirees that might be married to a state of New York retiree or another teacher that receives their benefits through NYSHIP through the Empire plan. In this particular case, the Medicare Advantage Plus plan will be the primary coverage, and the members can keep the Empire plan NYSHIP benefit as secondary for the pharmacy coverage. So they can keep it as secondary. And I confirm that with the state.
All right. A person says, why am I being forced to take the New York City Health Benefits Program or in Cuny Medicare Supplemental Plan or the Medicare Advantage Plan? You're not forced. You can do whatever you want. But if you waive your city coverage, you will not get Medicare Part B reimbursement from the City of New York, including Irma, and you will also lose the welfare fund Medicare Part D prescription coverage, which comes to you at no premium cost. So no one is forcing you to take a Medicare supplemental plan or the Medicare Advantage plan from the New York City Health Benefits Program. But there are advantages to doing it. One is the city reimburses your Medicare Part B premiums. If you leave the city system, you don't get that money. And our current rules, as they stand now, is you've got to be part of the New York City Health Benefits Program, whether in GHI Senior Care or the new Medicare Advantage plan, to be eligible for the Welfare Fund Medicare Part D prescription drug coverage, which comes to you at no premium from the Welfare Fund. So no one is forcing anybody into anything. I think we got to be clear about that. You can enroll in traditional Medicare and find your own secondary insurance and pay for it. That's purely up to you. Participating in the New York City Health Benefits Program means you get your Medicare premiums. What you pay for Part B that's going to be deducted from Social Security, that gets reimbursed to you only if you're participating in the New York City Health Benefits Program. The $191 per person for senior care is reimbursable? No, that is not reimbursable. The link to the presentation slides, I think that is in the chat if you want that. If you waive your city plan, which this person insists is not accepted in Indiana, can you restart it at a later date? As long as you retire with eligibility for retiree health coverage from the city, yeah, you don't have to take it right off the bat. You retain your eligibility. Can we have two Medicare Advantage plans at the same time? No. What are the downsides of using an out-of-network provider? Is there a higher copay in the Medicare Advantage plan?
No, the in-network copays and the out-of-network copayments are identical. So whether you see an in-network contracted provider or an out-of-network Medicare participating provider, the cost share is going to be exactly the same. So from the member's perspective, there really isn't an advantage to seeing an in-network provider versus out-of-network. The advantage is in-network providers are more familiar with the claim submission and dealing with the program. So that's really the only advantage. But from a member's perspective, it doesn't matter in or out of network.
If we're on Medicare Advantage plan, are we still technically on Medicare Parts A and B?
If you're under a Medicare Advantage program, you technically still have you're still Medicare eligible. What's different is your Medicare Part A and Part B benefit are administered through the Medicare Advantage carrier. So by enrolling Medicare Advantage, you're not giving up your Medicare eligibility, but we administer the Medicare benefits. So it's no longer administered through the federal government, it's administered through the Medicare Advantage plan.
Okay. Is the senior care supplemental plan covered under the Advantage plan, or is it a separate payment? They are separate. You're choosing one, or you currently have the choice of choosing one or the other. Senior care is the one that you're going to be charged $191.57 per person per month. Medicare Advantage plan, as we've discussed, has no premium. Here's a good one. One of my key medical providers has refused to accept Medicare patients. How widespread is this problem, and is there anything I can do about it?
It's less than 1% of all providers that have opted out of Medicare and have refused to participate in the Medicare system. So it's not widespread. It is really in certain pockets of geography. So you might see it in a very high income area, maybe in Manhattan or in Palm Beach, Florida. It is not widespread, but providers do have the ability to opt out of Medicare, and it's done on a 2-year basis. So unfortunately, if they opt out of Medicare, Medicare is not covering them, and the Medicare Advantage program would not cover them either.
Right. Again, we're getting questions. What if I relocate to another state? It's a national plan. But this is more specific. Are the enhancements, the Medicare Advantage Plus enhancements, available across the country?
That's actually a really good question that's come up on prior presentations, specifically around that transportation benefit. Yes, the enhancements that are included in the program are available to all retirees, regardless of where you live. So using Silver Sneakers, for example, that's a national program. There's over 16,000 gyms that participate in Silver Sneakers. So whether you live in Arizona or Montana, you'll have access to all of those enhanced benefits under the program, regardless of where you live.
Great. This person says, the continuous 15 years have me concerned. Should I work until 65 to be eligible for the Medicare Advantage plan? These are two separate things. The 15 years, if you're in TIAA, 15 years of consecutive service make you eligible for retiree benefits.
Right.
If you retire at age 62, say, and you've got your 15 years in, you're eligible for retiree benefits, but you'll continue to have, if you're under GHI CBP now, you'll be under GHI CBP until you are Medicare eligible at 65.
Right.
I got that.
That's it.
Right? So,
Yeah.
Yeah.
Mm-hmm.
Okay. Here we go. I think we've touched on this, but I'm going to ask it again. I heard that doctors can have varying types of relationships with Medicare. Some accept Medicare as full payment. Some still charge something above what Medicare pays. So what do you mean by, quote, participating, unquote, doctors, Kim?
They have to be a Medicare recognized provider. So there are two types of Medicare recognized providers, those that accept Medicare assignment, and then there are those Medicare providers that do not accept assignment that can charge an additional 15% above the Medicare allowable amount. So that's referred to as the Medicare maximum billing limit. So for those providers that do not accept Medicare assignment, that additional 15% that they can legally bill will be covered under the Medicare Advantage Plus program. So we will be treating those providers the same from the member's perspective. So we will pay the Medicare participating provider that accepts assignment the full Medicare allowable amount, and we will pay the Medicare provider that can bill the additional 15%, that additional 15%. And from the member's perspective, it'll be the same copay. It would be just the $15 for the specialist or $0 for the primary care doctor.
Okay. And here's this issue, and this comes up a lot. What are the issues of prior authorization under the Medicare Advantage program?
The prior authorization process is really in place to help protect the member, to ensure that there's no surprises, that the Medicare coverage guidelines were met before the service was rendered. So under traditional Medicare, Medicare retrospectively looks at a claim to determine if medical necessity was met. So in those cases, you could have a procedure that's done that Medicare could come back and say, it didn't meet our requirements, and they could deny it, and then the member is ultimately responsible for that. Under the Medicare Advantage program, that medical necessity review is done on the front end, and it's done through a prior authorization process. It's not for every service. So you don't need to get referrals to see your specialist, but every service doesn't have to go through the prior authorization process. It's more commonly for your planned inpatient hospital stays, surgeries, your complex diagnostics like your CAT scans, PET scans, MRIs, your therapies, your infusion therapy, things like that. So over more than 90%, 95% of the procedures that you have done don't require prior authorization. So look at it this way, and this is a similar process that happens today for the active or the pre-65 retirees. You have a prior authorization process that's in place today under the GHI CBP plan. So it follows the very similar scenario.
Okay. question about the hearing aid benefit. I'll be talking about that a little bit later briefly. The question is the hearing aid benefit 100% as it is now for active members? Well, that's not quite accurate. The hearing aid benefit is not 100%. It is for some devices. You can get some devices at no copay, but I'll address that later.
But Pat,
let's talk about the hearing aid benefit under Medicare Advantage.
The good thing is it's a stacked benefit. So I know that Cuny, the PSC Cuny Welfare Fund has a hearing aid benefit. Look at the Medicare Advantage plan as an additional enhancement on top of that, and you can use it either first with us or secondary with PSC Cuny or vice versa. So under the Medicare Advantage plan, it's a $500 benefit. So if the Union Welfare Fund offers X dollars towards the hearing aid, you get another $500 through the Medicare Advantage plan. So you can use them on top of each other.
Right. No, and that's a nice thing. Spouses are covered under Medicare Advantage, the Medicare Advantage plan. Your retiree health benefits, if you add your spouse as a dependent on your plan, they're covered. What happens to vision and dental benefits when we retire? I'll be talking about that. You keep them. Short answer. Would I keep my catastrophic coverage? Yes. If you have a catastrophe major medical policy through the Welfare Fund or through New York State United Teachers, that is not affected by the Medicare Advantage plan or your choice, whether you take senior care or the other. That's separate. That's an individual policy. What would it cover beyond Medicare Advantage? Well, one thing that the Welfare Fund Catastrophe Plan covers is reimbursement for home health care aids. That's the most common claim made on that, and that is not covered by the Medicare Advantage plan, one of the things. Skilled nursing care limit of 100 visits. Is that per year?
The skilled nursing facility benefit is 100 days per benefit period. And this is the Medicare benefit period. So the way this works is you have days 1 through 100 covered at a zero copayment. So that's the full benefit, the full amount. If you're out of the hospital or a skilled nursing facility for 60 days, you qualify for a new 100 days. So you have to be out of either a hospital or a skilled nursing facility for 60 days in order to qualify for a new benefit period of 100 days.
Okay. Are there lifetime caps under either senior care or the Medicare Advantage plan?
There are no lifetime caps.
Right. The Affordable Care Act made that illegal. This may be I'm going to give it a try. My 70-year-old spouse is retired and is covered by Blue Cross Blue Shield that replaces her Medicare. How does that change when I retire next year and take senior care or the Advantage Plus? Will she automatically be covered under my Cuny plans, and at what costs? If you add your spouse as a dependent on your retiree benefits, there's no automatic coverage. You have to add them. When you fill out your retiree health benefit forms that you get from your campus benefits officer, you add your spouse as a dependent or you don't. If you add your spouse as a dependent, they will be covered either by senior care or the Medicare Advantage plan. If your spouse is enrolled in a Medicare Advantage plan, you don't want them to be a dependent on your Medicare Advantage plan, or they could drop theirs and join yours. I think that answers the question. Will the GHI senior care plan be available to individuals who retire after 2022?
Yes.
I think that's a yes.
Yes.
If there is no copayment for primary care physician visit, does that mean the doctor gets $15 less? Are you reimbursing the physician $15 more since he's not getting the copay from the patient?
No, the way the provider reimbursement works is it's based on Medicare allowable. So using a $100 claim as an example, if it's the primary care physician, that $100 claim, the member's not paying a copayment, so we're going to pay that provider the full $100. If it's a specialist, look at that same $100 claim, the member is responsible for the $15. So the member would pay $15, the plan would pay $85. So the providers still getting that full $100. They're getting $85 from the plan and $15 from the member.
Great. If we opt to stay, I think, can we change to Medicare Advantage at another point? Yeah, if you don't want to, if you opt out of Medicare for the coming year and you're retiring next year, you can come back to it. Yes, you are able to change every year. You have the opportunity of changing health plans. Should I keep buying the optional rider to get coverage of 365 days since the Advantage plan only covers 100 days?
No, the Medicare Advantage plan covers 365 days of hospital coverage. So that's automatically included in the Medicare Advantage plan. You do not need to purchase a separate rider.
Right, and you wouldn't be able to because it's part of the plan. What about eyeglasses, hearing, dental? I'll talk about that in a few minutes. Mental health, anything you want to add about mental health coverage, Kim, under the Medicare Advantage plan? Well,
mental health benefits are covered under the program because they're a Medicare covered service. So they will be covered under the program. We cover inpatient mental health services as well as outpatient mental health services. Outpatient services with a mental health provider would be the $15 copayment because it would be a specialist, but that's all covered under the program.
Great. Will employees have to opt out of the Medicare Advantage Plus plan to be in GHI senior care? If you're, as an employee, you're not in the picture. I mean, you'll have the choice of choosing it when you decide to retire and fill out your health insurance application forms. So you don't have to worry about opting out because you're not in anything. The people who are opting out are the folks who are already retired. Will I be able to use my benefits if I move out of New York City? Absolutely. We've talked about that. Okay. In addition to my health plans, I'm also, this may be just particular, but I'm going to go for it. I'm also eligible for coverage by the New York City World Trade Center Health Registry. How does this fit into Medicare Advantage?
It's not impacted at all. So the World Trade Center fund will be separate and neither one's impacted by that.
Right. Well, my current major medical insurance, and I'm assuming that you're referring to catastrophe, will it be covered by Medicare Advantage? No, that's separate, if that's what you mean by major medical. Are WellCare and Medicare Advantage plan and NYC Medicare Advantage plan the same or different? Are you familiar with WellCare?
It's a different company. They are not the same.
They're not the same. Okay. Here's one. If I'm living in Canada, when I come back, does it have to be, do I have to be living here? Can it be a visit every 6 months when I visit my regular doctor for a checkup?
It all comes back to what physical address is registered with Social Security and Medicare. So if you have dual residencies back and forth, and as long as you come back and you have, you're back in the United States, you're not out of the United States for more than 6 months, it comes down to what address Medicare has you registered with. So it should be fine, but it ties back to what Medicare has.
Okay. Question about eyeglass benefits. I'm going to talk about that. When we retire, can we stay with Aetna and not switch to Medicare Advantage Plus? I think,
As of right now, the city's requirements or their enrollment guidelines that they have in place is after 2022, the only options that will be available will be the Medicare Advantage Plus plan or the GHI Senior Care Plan. That is what the latest information is that was shared. So my initial answer now is no, you won't be able to, but I don't know if that's going to change or not.
right. Will the Hospital for Special Surgery and Memorial Sloan Kettering be accepting the plan? The Medicare
They're
Advantage?
actually, Memorial Sloan Kettering and Hospital for Special Surgery are in-network contracted hospitals. Those contracts were finalized last month. So they're in network. Yes, they'll accept the plan.
Great, thank you. Can you give more details on Healthy Pantry?
The Healthy Pantry benefit is designed for members with certain chronic conditions that through some dietary changes, the member can actually manage those conditions better. I use a diabetic or a cardiac patient as a good example. So the members that qualify for the Healthy Pantry benefit will get a shelf-stable pantry box delivered to their home each month, and they will also have a nutritional counseling session with a nutritionist each month. So it's really designed to help members manage that chronic condition better through dietary changes.
Thank you. Will senior care still be available? Will it be permanently available as an alternative to the Medicare Advantage plan? Permanent? It's hard to say.
As of right now, it's the plan that's been in place for 50 some odd years, but I can't say guarantee.
Right, but certainly there's no changes to that on the horizon.
Right.
What happens? This is a really good one. What happens to spousal coverage if the primary has passed? So, if you die before your spouse will have the option of COBRAing your New York City Health Benefits Program coverage. So do you know the COBRA rate for the Advantage plan, Kim?
For 2022, the COBRA premium would be $7.50 per member per month. So after 22 for January 1st, 23, it is a zero premium.
Wow. And then as far as welfare fund benefits go, there's a survivor benefit from the welfare fund. It's about $1,700 a year. And that includes Medicare Part D prescription drugs, dental, vision, and hearing aids as a survivor for life, $1,700 a year. Okay, we may have done this, but I'm going to go for it. If an out-of-network doctor bills Medicare Advantage and is paid whatever the program pays, will the doctor then bill the patient for the remainder?
No. So the way it works is if it's an out-of-network provider that participates with Medicare, they're going to bill the New York City Medicare Advantage Plus plan, and we will pay that provider up to the Medicare maximum allowable amount, whether he's accepting assignment or not accepting assignment. That provider is not allowed to balance bill members because you're a Medicare member. So the same Medicare billing laws are in place to protect you, whether you're under traditional Medicare or the Medicare Advantage Plus program. So we will pay that provider up to the full amount that they would be receiving through Medicare. They cannot balance bill.
Okay. It says $0 premiums are guaranteed for 5 years of the current contract. Will retirees be notified early enough to opt out if through new negotiations that any of that changes? That makes sense?
Yeah, absolutely. So retirees will know well in advance. So we have the 5-year contract, and then it's renewable for another 6 years on an annual basis. But if there's a change to the premium, retirees will have ample notice of what that new premium would be.
Okay. And this, I'm sure this was a little confusing. The high option drug rider does not apply to you folks.
I apologize.
Yeah, that's we saw that coming. You've got the welfare fund drug benefit, so no worries about that. There's no premium charge for that. Okay. Well, this is okay. How does the Empire Blue Shield work right now with Part A Medicare?
The way the senior care plan works today is it's a bifurcated product, which means that GHI pays secondary for all professional providers. So Medicare pays their 80%, and then the GHI portion fills in the secondary portion. Empire Blue Cross Blue Shield is the hospital provider under the GHI senior care plan. So the way it works is Medicare Part A pays their portion less their Part A deductible. That's what's picked up by the Empire Blue Cross Blue Shield hospital benefit. So that's how senior care works. Now, under the Medicare Advantage Plus plan, we're combining all of those 3 pieces together into one program. So you would just have your $300 copayment for an inpatient hospital admission. I don't know if I answered that.
I think so. Is the paperwork for a participant the same, seeing an in-network and an out-of-network provider? I'm assuming that means under the Medicare Advantage plan.
Yes, it would be the same. You simply show your ID card to the provider, and the provider is the one who submits the claim. And the only thing the member would be responsible for would be their applicable copayment if there is a copay.
Right. Do we still get the Medicare Part B reimbursement when we take Medicare Advantage? Yes, you do. You just have to be participating in the New York City Health Benefits Program. So either way you go, senior care or Medicare Advantage, you're going to get that Medicare Part B reimbursement. Is there an additional fee for spousal coverage under Medicare Advantage Plus? No. Okay. Is there a list of participating local Medicare Advantage providers, and will it be updated?
The provider list is located on the dedicated website that we set up for the Medicare Advantage Plus program. If you go to the Office of Labor Relations website, it has a link directly to that provider finder tool. The providers are updated live. So it's updated on an hourly basis, a daily basis. So it is up to date, and it's already pre-populated specific to the New York City Medicare Advantage Plus program. So go to the Office of Labor Relations site, to the Retiree tab, and that'll bring you directly to the Provider Finder search tool.
Okay. This may be for you, Talene, if I can't do the logic on this. Can we be eligible for our city health benefits if I retire at 61 but turn 62 before Travia and vacation leave? Yes. If you turn 62 during your Travia, then you're going to be eligible for your health insurance benefits. What kind of copay and coinsurance should be subject to out-of-pocket payment? All of them?
Everything under the Medicare Advantage Plus plan, every copayment and deductible that you pay counts towards that maximum out of pocket. So that $300 inpatient hospital copay comes off of the $1,470. That $253 deductible comes off of the $1,470. Every time you see a specialist at $15 a visit, that comes off of the $1,470. So all of the medical expenses in regards to co-payments count towards that annual maximum out of pocket.
All right. Is there any conflict between Medicare Advantage Plus and Medicare Part F? Wow, I never heard of Medicare Part F.
Maybe they're referring to a Medicare Supplement Plan F. You would not be able to have a Medicare Supplement Plan F and a Medicare Advantage plan because the Plan F pays secondary to traditional Medicare. So you wouldn't be able to have both.
Right. Part B is part of it, and Part D, no, it's not going to conflict with your welfare fund, Medicare Part D. A member says they got hearing aids from Hear USA without paying anything. Yes, there are hearing aids available with no copay. I can talk about that later. If I enroll in the plan, can I change the GHI senior care at a later date? Yes, you can. You can change every year. CPAP, question mark.
CPAP is a Medicare covered benefit under the durable medical equipment section of Medicare. So it would be covered under the Medicare Advantage program, but something like a CPAP is one of the services that may require prior authorization. So you just need to have your provider coordinate with the plan to ensure that you can continue to keep the same CPAP machine that you have right now, but it would be covered under the plan.
Okay. If we need urgent emergency care while traveling abroad, and we have medical and dental coverage via a travel insurance policy, is Medicare Advantage the primary or the secondary insurer?
Typically, if you have travel insurance, the travel insurance is the one that would pay. You can put both plans under there. The travel insurance may ask for a subrogation and then submit the claim to us. So from the member's standpoint, the easiest thing to do is submit it through the travel insurance. Make sure the travel insurance knows that you have medical insurance through Medicare Advantage, and then they'll reach out to us to keep you out of the middle.
All right. Mental health. How many outpatient visits? Should we move on?
I think we need
Okay.
to move on to your section.
All right.
Yeah.
Let me just do this last one. I think my stuff's going to be simpler. So let me just do this last question for Kim. How many outpatient visits are covered per year for mental health?
There is no cap. So it's based on whatever you medically need.
All right. So folks, if your question did not get answered, you can always send the question to me at that communications email address, communications@psccunywf.org. I'll put it in the chat, and we're going to move on. Thanks a lot, Kim. That was great.
Thank you. I appreciate
Very
it.
helpful. Super. So I'm going to go right into sharing my screen. So bear with me. It's always a little bit of a leap of faith. And here we go. Let's go back to the beginning. All right. And that's you and me as happy retirees using our welfare fund benefits. Donna Costa, our executive director, always thinks it's important for you to know exactly where the money comes from for this. And it comes from the city of New York via Cuny. And how do we spend it? Look at that pie chart and you can see generally most of the money is spent on the drug plan. That is an expensive benefit, and we're glad that we're able to provide it. And then otherwise, the big chunk goes towards dental, which is also an expensive benefit. And the rest of it is divvied up at much smaller amounts of money. We've got this agreement between the PSC and Cuny. We're a small staff supporting 20,000 active and retired members, and we are funded on a per member basis. And Donna likes you to know that it's not a bottomless well of money. But here we go to drugs. So if you retire and you are under 65, you're going to keep your CVS Caremark prescription drug coverage. You're going to continue to use your same CVS card. If you retire at 65 or over, that means you're Medicare eligible and you will be enrolled by us in the SilverScript Medicare Part D drug plan. Currently, as an employee, if you're getting injectable or chemo drugs from the PICA program, when you are Medicare eligible, you will get them from the Welfare Fund drug plan. If you retire and you're not yet 65 and you're getting those drugs from PICA, that will continue until you turn 65 and become Medicare eligible, at which point you'd get those drugs, injectables and chemo drugs from the Welfare Fund. And the same goes for diabetic drugs. Before age 65, diabetic drugs are covered by your basic health plan, just as they are while you're an employee. Afterward, those drugs are covered by the Welfare Fund SilverScript Medicare Part D prescription plan. So when you sign up for Medicare, you sign up for Part A and Part B. Do not sign up for a Part D drug plan, please. You don't need to, and it will mess things up a little bit. You'll have to drop it to participate in the Welfare Fund Part D drug plan. We will enroll you in the SilverScript Medicare Part D prescription plan. The enrollment form is part of the forms that you get from your campus benefits office when you're signing up for your retiree health benefits. You and your spouse, your dependent partner, will both be filling out a SilverScript Medicare Part D prescription application. Most welfare fund benefits don't change on retirement. The dental plan continues. You've got the choice of Guardian or Delta. The eyeglass benefit, free eyeglasses if you choose the frames that are in the Davis Vision Collection or contacts in the Davis Vision Collection, that stays exactly the same. And the same with hearing aids. And just to touch a little bit on that hearing aid issue, as we said, we've got a pretty good hearing aid benefit from the Welfare Fund, so that would be the primary insurer for that. And then you can, if you take the Medicare Advantage plan, you can get another $500 off of whatever you spent out of pocket. But as we discussed, there are some devices that come with no copay. And then at the higher ends of technology, there is a price. I can speak personally, saying I've got Hear USA hearing aids on right now, and I'm a happy camper. I'm a satisfied customer. So it's worth checking out. And if you've had any stigma, you think, attached to hearing aids, let go of it, because they're much better than you might imagine. How to use your dental benefit. I think most of you are probably familiar with this, but Guardian members can go online to find a provider. If you don't currently have one, or you changed ones, or you moved out of the neighborhood, it is a PPO. So you can go out of network, although coverage is better within network. And you can always call Guardian at their 800 number. These provider numbers are all available on the Welfare Fund. And our plan number, Welfare Fund website, I should say. If you're in the Delta HMO, and those of you who are in Delta know that Delta assigns a dentist. So to change dentist, you got to call Delta. But none of this is all going forward. None of this changes as a retiree. It's exactly the same coverage that you have as an employee. And it was always been important for the PSC, the union, to make sure that retirees have benefits that are at least as good as they had as an employee. And in some cases, they're better because you're covered by Medicare. Davis Vision. I think most of you are familiar with this. You can go to online and find a provider, or you can call their number and find a provider. Your Davis Vision member number is your Social Security number. And please take advantage of the eyeglass benefit. As I said, if you choose Davis branded frames or contacts with a variety of lens treatments, all that kind of different lenses you can get. It's all covered by the benefit, and there is no copay. Here USA, there is no website for Here USA as yet, but call that 800 number. Again, all of these numbers are available on the Welfare Fund website. And you call, they'll tell you the practitioners that are available in your area. I can say that the office up on Broadway, 1776 Broadway, just below the park, is great. Really great audiologist there. And I think if you go there, you'll be happy. Some welfare fund benefits do end at retirement. Disability, for instance, is considered to be employee income replacement. If you're unable to do your job, then you can get some income replacement as a disabled employee. There is no disability benefit once you're retired. There is a death benefit for your survivors if you die while in service. The extended medical benefit that lives on top of GHI ends once you are enrolled in Medicare. Dependent spouse benefits, we did talk about this a little bit earlier. If you predecease your spouse, you can purchase the welfare fund that your surviving spouse, can purchase the welfare fund survivor benefit, which includes all the welfare fund benefits, drugs, dental, vision, and hearing aids at the cost of about $1,700 a year, which is a very good deal. That's much less than the cost of buying your own Medicare Part D plan that doesn't have any of the other dental, vision, or hearing aid benefits along with it. And then we did hear how the COBRA rate for the Medicare Advantage plan if you predecease your spouse. This is something that people seem to, the slide turns invisible somehow. Maybe it's got too much information on it, but please, if you haven't written anything down, and I know that you're completely overwhelmed by all the information here, but if you are currently paying for catastrophe major medical coverage or long-term care from MetLife or term life insurance from New York State United Teachers, you must contact those insurers before you retire and let them know you're retiring. You have to let these insurers know your correct mailing address, your phone number, your email address. Tell them your last payroll date and that you need to have a bill sent to your home. The first bill after you go off payroll has to be a paper bill, a direct bill sent to your home. After that first billing period, generally the insurers will send you the form so you can arrange for automatic deduction from wherever, from a bank account. You can set it up with your credit card. You can have it deducted from your pension. But it is not a seamless transition. It's not automatic. If you forget to contact the insurer when you go off payroll, they stop getting paid. And then generally there's a grace period. It's usually around 60 days. But if you don't get in touch with them after those 60 days, the policy gets terminated. If you catch it soon enough, I, at the Welfare Fund, will advocate for you. And maybe there were extenuating circumstances why you missed it. There might have been emergency situations in your home that you just were so overwhelmed you couldn't get to it. In some cases, we can get it back, but it is not guaranteed. The best way to maintain the catastrophe major medical or long-term care or term life policies that you're currently paying for by payroll deduction is to contact the insurers. The numbers for these folks, again, are on the Welfare Fund website. They're on our contact page. Please write this down many times. Write it on the back of your hand. Whatever it takes so that you do remember to take care of this. I think most people do pick it up, but I got to tell you, it's always surprising the number of people who said, I did go to the pre-retirement conference. I never heard anything about it. Happens. You left, you went to the bathroom, I don't know. But you've got to do it yourself. There's no automatic transition from payroll deduction to pension deduction going into retirement. It's not seamless. You are the seam. You have to arrange this. This is our website where there's all kinds of stuff. Contacts page has all the numbers for all of the insurers, all of our providers, lots of frequently asked questions, forms for getting reimbursed for out-of-network dental reimbursement, say, out-of-network eyeglass reimbursement, that kind of thing. It's all on here. And then very detailed descriptions of all of your retiree benefits: dental, drug, hearing aids, vision, extended medical if you're not yet 65. It's all here on the Welfare Fund website. It is a really good source of information. I manage this site. I update it frequently. I hope that you'll take a little time to click around, see what's available there. It's a very, very useful website. It's the first place to go if you've got questions. And it has all of our Welfare Fund staff email addresses, so you can write to us directly. So here we go. That communications at psccunyWF.org. That's me. The other email address for me. And there's our phone number. We are occasionally in the office. All of us are in 1 day a week at this point. Some of us are in more often. And so you can call that number. You'll get the phone message that tells you the extension for different benefits. And again, to reiterate, the website is a very useful place to get information, links to the benefit vendors, summary plan descriptions, applications, claim forms, and then lots of useful stuff. We've been including lots of information about the new Medicare Advantage plan on our site. We've also always had lots of information during the COVID period about when groups are available, when are eligible for the vaccine and testing, where you can get testing, all of that kind of stuff. It's not just strictly about your drugs, dental, vision, and hearing aids. So let's go to the questions.
Okay. My husband turns 65 next month. Does he automatically go on Silver Script? He's currently on my insurance.
He's turning 65 next month, and so he can call the office. Often these folks are ahead of the game. They'll see that spouses are turning 65. But if you didn't get any communication from the Welfare Fund, call the Welfare Fund and say, my spouse is turning 65, he needs the Silver Script application.
Mm-hmm. Will I be covered by the welfare fund for any of these benefits, including drugs, if I am not eligible for the New York City retiree health coverage?
If you're not eligible because you're not joining the New York City Health Benefits Program, you still do retain eligibility for dental, vision, and hearing aids. But if you're not eligible for retiree health benefits at all, then no welfare fund benefits. But say that you're on your spouse's coverage, your husband got insurance from a private company, and you want to take advantage of that insurance and you waive your retiree health benefits, then you can do that. You do have to officially waive them. You've got to send the form in. But when you do that, then you still do retain eligibility for welfare fund, dental, vision, and hearing aids, but not the Medicare Part D prescription plan. You do have to either be in the Medicare Advantage plan or senior care to participate in our Medicare Part D prescription plan.
Can we be refunded when ordering glasses online, as from companies like iBuyDirect.com? They are much cheaper.
Yes. Up to $200, up to $200, not $200 guaranteed. Depends on what you paid.
Okay. Is there a cost to continue being receiving welfare fund benefits once we are retired?
No.
But there's a cost, as Pat mentioned,
Sure.
for the survivor plan.
Right. As a survivor, it's over $1,700 a year. I'm not exactly sure the figure, but it's about that, $1,700 a year for survivors.
Okay. When and how do you enroll in retiree PSC? Is monthly fee the same? Automatic payments?
Talking about I think that's about union dues.
If it's about union dues, you could reach out to PSC directly, and you will speak to one of the enrollment ladies.
Right.
If your question is about the PSC retiree benefits, you're going to get a packet of forms from HR
Right.
to complete and return to HR. So HR controls the whole process of all these benefits.
Right.
Let's see here. Is there a death benefit?
There is a death benefit for employees who die in service. There is no death benefit for survivors of retirees.
I don't understand what this word is, but does someone who left the union eligible for benefits?
Here's the only union requirement, and that is if you have a term life policy from New York State United Teachers, or say any of the NYSET plans, the legal plan, catastrophe major medical, you do have to retain union affiliation to maintain those benefits. That is a New York State United Teachers union requirement. That is the only union requirement. Welfare fund benefits continue whether you decide to join the retiree chapter or not. But NYSET benefits that you would be paying extra for by payroll now, like the catastrophe major medical plan or term life, or they offer all kinds of insurance, boat insurance, house insurance, motorcycle insurance. If you want to maintain a NYSET benefit, NYSET requires union participation. The welfare fund benefits, there is no such requirement.
And just to emphasize, there are a couple of questions about, I have a catastrophic major medical, Mercer, or term life, what they need to do just when they're retiring.
Call the insurer. The numbers are on the welfare fund website on the contact page. You call them up, you say, I'm retiring. This is my last payroll date. After that date, please send me a direct bill. You make sure they've got your current home address. Some of you may have this Mercer, currently administered by Mercer Catastrophe Major Medical Plan. You signed up for it 1 trillion years ago. You've been paying for it by payroll deduction, so it doesn't matter where you live, but they need to have your current address if they're going to direct bill you.
And is catastrophic major medical automatically included in your GHI CVP plan?
No.
No.
We need to move on to
Yeah.
the next item on our agenda.
All righty.
Thank you so much, Patrick and Sandra. And now I would like to introduce Bill Friedheim, the chair of our retiree chapter.
Hello, everybody. I've just put 2 links into the chat. At least I think I just put 2 links into the chat. One is the link to the retiree chapter webpage, and the other is an important link that the retirees chapter webpage that the retirees chapter has created, and that's what's happening to retiree healthcare, which obviously has been an issue during this pre-retirement conference and then some. So I'm in the unenviable position of being, I believe, the last speaker after many hours, during which you've been overwhelmed with information, really good, important information, but overwhelmed. And you're probably all at the point of exhaustion. And I think the last thing you probably want to do is listen to me. So I'm going to be mercifully brief. I just want to tell you a little bit about the retiree chapter. Let me just start with this. As somebody who's been retired 15 years, I can attest to the fact that there's life after retirement, good life after retirement. Retirement is a really nice gig. And of course, the greatest luxury you have during retirement is time. For many of us, that means more time to travel. For many of us, it means more time to bond with grandchildren, or maybe for some of you, great-grandchildren, more time to read. For some who are still big into their research, it means more time to research and publish if that's what you choose to do. So let me tell you a little bit about the retiree chapter. And what I'm going to do is I'm going to read basically our mission statement. This will take a moment, but it'll tell you basically what our chapter is about. The retiree chapter is enriched by the collective wisdom and experience of 2,900 plus members as teachers, professionals, scholars, learners, trade unionists, and citizens of the world. Our goals are to draw on that experience to strengthen our ties to a university whose curriculum, governance structures, and outreach to a diverse student body we help to build, to integrate our chapter's activities into that of a progressive academic union, to fashion alliances with other retiree advocacy organizations, and to enhance the safety nets so vital to us as retirees: Social Security, Medicare, obviously very important given what's been discussed today, and health benefits, pensions, and welfare fund. At our monthly meetings, we address issues and present speakers on academic, labor, political, cultural, and economic topics that reflect these goals and are of interest to our members. And you can get a sense of these meetings and what we've done over the past year by going to the retiree webpage, which I believe I put in the chat. And if I hadn't, I'll put it in the chat again once I'm finished. I mean, first of all, let me just say the membership in the retirees chapter is a bargain, $85 a year, $40 if you're retiring as an adjunct. And what it provides is really a continuing connection to the university, a continuing connection to the union, and very importantly, a continuing connection to your colleagues. We meet the first Monday of every month. We have semi-annual luncheons in January and June, although obviously during the pandemic, those luncheons unfortunately have been virtual, or maybe fortunately, since all our meetings are now on Zoom. Actually, our meetings are much better attended than ever before because people don't have to travel down to 61 Broadway to attend our meetings. And of course, if you live in California or Hawaii or Israel or France or what have you, there's no way you're going to attend our meetings in person. And we also organized additional cultural and social activities. Before the pandemic, walking tours. We hope after the pandemic, walking tours. Theater parties, which we've done virtually. And of course, we did them in person before the pandemic. A writing group, a movie group, and more. So as I said, chapter dues are $85 a month, $85 a year for full-timers. With that, you get the Clarion, you get the newsletter. It also continues your eligibility, as Patrick pointed out a moment ago, for NICE benefits. What's really changed, and I just want to kind of end with this, are two things, that basically have changed the face of the retiree chapter in the last year or two. One, obviously, the pandemic, since all our meetings are now online. And the second, something that's certainly been a point of discussion today, is the change in retiree healthcare benefits. And I just want to share my screen for a minute. Bear with me a moment. Maybe, whoops, this is not working. Maybe since I sent these links to Naomi, who sent them to Spark Street, could you put on that what's happening to retiree healthcare page? And if not, let me I put a link to the page in the chat. Here we go. Okay. And this page is really kind of a one-stop page that will give you incredible amount of information about the changes in retiree healthcare. Links certainly to the Alliance, to the Office of Labor Relations, to the Welfare Fund, all sorts of information on here. A lot of it tied to questions that have been asked today, and also some information that maybe was not provided today. For example, right at the top of that page, it indicates that there's currently a temporary restraining order in place. There's been a lawsuit that's before Justice Leon Frank here in New York City that has extended the deadline for people opting in or opting out to either the Medicare Advantage or the New York Senior Care, extended it indefinitely, mainly around the issue of access to doctors. That's not a resolved issue. There's also a link to the temporary restraining order. It's only 4 pages if you want to read it. A link to a recent city council hearing on this, and also a history of the chapter's involvement in this over the past year. I mean, we've had meeting after meeting after meeting about this. And maybe as some of you know, the PSC was one of 5 unions that actually voted against, in the Municipal Labor Committee, against or wanted a pause in this move to Medicare Advantage. I'm not saying anything about the pluses or minuses of Medicare Advantage as opposed to New York Seniors Care. I don't want to get into that. But as I say, this page is just chock full of information, and I would hope that you would take a look at it. And I also hope that, I'll put it in the chat again, that you look at our main webpage, which describes our political and social and cultural activities, also explains how to join the retirees chapter, And if you want to join, you can always go to the PSC Cuny website to About Us and then click on membership. And there's a link to a page where you can join the Retirees chapter. And with that, let me say, you're about to step into, some of you maybe imminently, maybe some of you in a couple of years, to another stage of your life. Enjoy, and hopefully you'll join us at the Retirees chapter. And I will again put those links in the chat. So I'm finished, Naomi. I mean,
that's lovely. So Felicia,
and I'm sure people don't want me to go on endlessly.
No,
I'm mercifully
thank you so much, Bill. And Felicia will close us out.
Hello, everyone. You're still here, 246. That's great. I hope you got a wealth of information that can start you on your pre-retirement process. As Bill says, it's the best gig in the world. Don't want to keep you any further. I want to thank the panelists for providing their time today. And I hope everyone enjoyed today and the weekend. Have a great day.
Thanks,
Thank
everyone.
you. Bye, everybody.
Bye.
So long.
Bye. Thank you.